By choice, communications expert, Pan-Africanist, a truth seeker and believer in people power, and Eric Latin, agent provocateur, the man in the chair, seasoned journalist.
Thank you. Good to see you.
Good to see you too.
That's come out very well. Like, it's really good to see me.
It really, really is. It really is. Should I say it one more time for emphasis?
Yes.
It really is very good to see you, Eric.
No, it doesn't come out like the first time. But okay, I'll still take it. Okay. CT Muga, good morning.
Good morning.
How you doing?
I am doing well, thank you.
Tell him.
Good to see you, TT.
Lovely. Delighted. Thank you.
Oh, I thought you were calling me lovely.
No. I am saying it is lovely that you have greeted me with such enthusiasm.
Oh, right. Okay.
Yes.
Feel free to call me lovely anytime,
All right. I will
putting
feel
it out
free
there.
anytime to call you lovely.
Just wait. It'll come.
Okay.
All good things come.
To those who wait. Got it. All right.
So it's the end of the week. The numbers in the country have risen. What's our current tally?
Oh, yeah, it's a tough one now. We're
like
looking.
that,
It is.
It's just like that. It's just a tally.
Deep breath
What's
stuff.
our number?
Numbers in Kenya rose to 234 as of yesterday with extra cases. That's the national tally. So if we're going to the rest of the world now with the COVID update, 2,182,197 as of the end of 24 hours. 145,521 deaths. And still looking at very high numbers coming out of the Western Hemisphere, specifically the United States. If we want to look at those numbers, yesterday they were just over yesterday just over 600,000, but as of today now, the numbers that we're looking at, the United States, whereas yesterday they were at 640,000, today 677,570 with 34,617 deaths. On Monday there were 26,000 deaths. Today there are 34,000 deaths. So between Monday and today, there's been an increase of 6,000 deaths in the United States. Spain at 184,948, 19 deaths. Italy at 168,941, 22,170 deaths. France with 165,027 cases, 17,920 deaths. In Germany with 137,698, there are 4,052 deaths, so still quite low there. China, 82,367, having maintained some sort of equilibrium. Deaths still at 3,342. Oh, yeah. So this is what we're looking at right now in terms of the numbers.
Tanzania still remaining at 82.
Yesterday, Tanzania was at 88. That's what we
88,
saw yesterday at the beginning of the day. All right, let's look at where the numbers are right now. Tanzania, just one moment. Tanzania now at 94 deaths. So there's an increase of 6.
Yeah, 94.
Sorry, 94 cases.
Okay.
So an increase of 6 deaths from yesterday.
Cases.
Yeah, cases. And still at 4 deaths. They were at 4 deaths yesterday, still at that case, still at that point today. And looking at the rest of Africa, still really maintaining the same numbers. Nigeria, increase of 19 cases, now at 442. Kenya, as we said, 234. DRC at 267. Understanding that DRC is now dealing with extra cases of Ebola. Now, 2 weeks ago, where they had 2 cases. Now, unfortunately, they're at 10 new cases of Ebola. So they're dealing with double issues here. Okay, so that's where we see it. Numbers are still increasing. Again, going back to the United States, where Donald Trump spoke yesterday again, and he said, yeah, guys, we're heading to plateau. But unfortunately, it's not the case. They're going to hit 700,000 cases by this weekend if things continue.
And then they'll hit a plateau. Maybe that's what he meant.
Maybe.
If you look at, for instance, this is a small example of what's happening in Michigan, then that plateau will not be reached. It will be surpassed. When their governor decided that she was going to bring about a lockdown people came out in arms. I looked at those guns, lovely looking stuff. Who are they planning to shoot with those guns?
They're coming up. What do you mean? Coming out of their homes with
yes,
guns.
the people went.
They've been told stay at home.
They said no. Walingia was street. Let me put it simply. They were marching. They were chanting. They said no. They're not doing anything of that.
So they're protesting. They're saying no, we cannot lock ourselves down.
Can't stay inside.
And what's their justification?
Let's put it simply. They don't understand why they should be in a lockdown.
And that's the entire state.
No,
that's in Michigan.
They're Michigan specifically.
Okay.
I mean, just looking at other countries, I'm actually very surprised that the numbers in Nigeria are at 442. I'm very surprised.
Why?
Because people are not adhering to any kind of lockdown. Abuja has been locked down, supposedly. But we are told that there's epic traffic jam.
In Abuja?
On the outskirts of Abuja. So people are in and out. So it's huge in terms of what's going on. I'm very, very surprised that the reported cases are only at 442. I'm very surprised.
Are those 442 in isolation facilities?
Yes.
Or are some of them, all of them are?
No, not all of them. Some of them having been found here and there. Other states are now joining in, whereby the majority of the cases were in Lagos, Abuja, and Ogun State. Now, Ogun is just in close proximity to Lagos. Then we started finding other cases around. Oyo State joined. Plateau State joined, one case here and there, which then you saw that there was a lockdown then in Plateau, which is now about 4 hours from Abuja by road. And then states around Osun State, Oyo State, which are then again in the southwest area near Lagos. But also understanding that people travel, inter-country travel in Nigeria is quite high. So and people run businesses. That's what I'm saying. I'm very, very surprised.
But of interest is that in Michigan, they've reported over 2,093 deaths. Those deaths, infected 29,263. So the governor looked at these figures and said, "Apana, this thing is not pleasant."
Yeah, because they're witnessing a tenth of the infected cases in Michigan. People are dying. It's a tenth of the cases.
They're not the only one. There's a small little town in Louisiana along the Mississippi River. They, for the longest time, have had issues with petrochemical pollutions. And there's been a debate about this for the longest time. And the reason is because there are very many factories that are set somewhere along the line of the Mississippi River. Okay? This place is called St. John Parish. Now, where they are counting their numbers, they have a population of 43,000. But they have 1,100 who have already died.
What?
Yes. It's alarming. It's a small place. If it wasn't for coronavirus, you would know it because it's nestled between certain factories, big factories owned by DuPont and other such serious manufacturers. You wouldn't even hear of it. You wouldn't even know of it. But because of those numbers, and what is significant about that little town is that the people who are raising the alarms are the morticians. They are burying more people. The business is too brisk.
Yeah. They're saying
it's brisk. There are too many. I mean, they are talking about...
The demand is too high.
They're talking about last month. Last month, as in March, they buried the number of people who sought burial services were more than twice the month before. The numbers seem to continue going up. So if you are talking about the situation in the U.S., it is not something, it's not a laughing matter, to put it that way. No. By the time they surpassed the tallies in Italy, and Italy was by far the most alarming in the world, it tells you that those numbers are not likely to go down soon.
High numbers, the population is high as well. Let's also remember that.
Remember, the population of Nigeria isn't really far behind that of the US. Just so that we understand.
The US has 300 million people, give or take. Nigeria is around about 200 million. So
give or take 100 million.
Yeah, 100 million less.
Exactly.
Say 18 minutes after 6, this is the situation. It's Kenya's biggest conversation. Let's take a short break, take a look at the weather, and then we come back and see Timuga starts us off with today's proverb. And then we take a look at the headlines. Good morning.
24/7, around the world, non-stop. This is Spice FM. Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah!
You're listening to Spice FM.
This Friday morning, it's mostly cloudy in Nairobi at 17 degrees. According to the Met, there will be rain through the entire weekend, starting with scattered thunderstorms this evening. 26 the high and lows of 16. In Nyeri at 17 degrees, it's mostly cloudy conditions, highs of 24 and lows of 16. Nakuru is mostly cloudy this morning and will experience thunderstorms later with a high of 24. Eldoret at 14 degrees, the city of champions, will experience thunderstorms later on, highs of 22 and lows of 14. Kisumu at 21 degrees is mostly cloudy today, will experience thunderstorms as well, highs of 27. In Malindi at 27 degrees, it's cloudy conditions all through. Rain will make a debut very early in the day with highs of 31 and lows of 26. Mombasa at 26 degrees is cloudy as well, 29 the high and lows of 25 with scattered thunderstorms throughout the day. Hopping then into East Africa and Dar es Salaam at 25 degrees, it'll be mostly cloudy for most parts of the morning. Showers expected very early, highs of 29. In Kampala at 21 degrees, it's mostly cloudy right now. Showers expected by the time the sun comes up, 25 degrees the high and lows of 19. In Joburg, it's 9 degrees, clear skies this morning, and it will be sunny conditions all through, highs of 22 and a chilly low of 9. In Lagos at 28 degrees, it's clear skies this morning. However, showers will come in very early, highs of 33 and lows of 27. Take a look in New York at 5 degrees, it's clear skies all through, highs of 10 and lows of 2. Paris at 15 degrees, experiencing the first signs of spring there as well, highs of 25 and lows of 14. 11 degrees in London this morning, and showers expected early on with highs of 15 and lows of 8.
Mature, intelligent talk every morning. Spice up yourself. Mornings done right. 94.4 Spice FM.
Today's proverb.
Yes, one who causes others misfortune also teaches them wisdom. Let me repeat it. One who causes others misfortune also teaches them wisdom.
Mm-hmm.
Our learning process as human beings is often through experience. And suffering is something you experience, much as you also experience joy and happiness. Activities that we involve ourselves in, what we remember are the experiences and the outcome of those experiences. So, in this particular proverb, I think what is being said is very clear. You may go through some very traumatic times that are caused by others, but in going through that experience also smartens you up. That experience also opens your eyes and ears and makes you a little more acutely aware of the world around you.
Yeah.
Yes.
What's the origin of the proverb?
It's an African proverb. When we say African, it means that very many countries on this planet, or rather on this
continent.
Thank you very much. That word had gone. had completely gone. The word was coming to my mind.
It could be continent, but that's so easy. Why is City forgetting continent?
It had traveled. That word had traveled completely. Continent. There are very many countries on the continent that have similar sayings. So it is just, so you'll call it an African proverb. It's the best way you can put it.
I think the framing of that, though, is whichever Wahenga of that country did that, The framing of that is trying to excuse the person who's causing you misfortune. One who causes you misfortune teaches you wisdom. So it's okay.
They're saying, yes, that's one way of looking at it, or saying that, you may suffer. You do have a point there, actually, that you may suffer, yes, and somebody may have caused that suffering. But that suffering also teaches you something that could be valuable.
Yeah.
Yes.
We should have focused on just, every misfortune teaches you wisdom.
Or could also help that in the future, anybody of that ilk who comes along, you kind of ready and know how to deal with them.
You know how to deal with them.
Or if you're undergoing something that you consider traumatic like now, it ought to teach you. But therein lies the question, do people really learn? And if they learn, what do they learn?
It's called pinching your earlobe.
Yep. Learning is always an interesting subject. And determining whether somebody has actually learned is an even more interesting subject. Because you would assume that anyone who is in a position of authority, and here I'm going to be blamed for bashing those in authority. It isn't bashing, it's simply pointing out. You would assume that we would have learned in December, given the floods that we had and given the locusts. We would assume we had learned when we had substandard schools all over the landscape having problems. We would assume we have learned. We now have COVID, and what we are learning is that we haven't learned.
We haven't.
The lesson of preparedness wasn't learned.
Still hasn't come in.
Yes.
However, Ebola taught some of those West African countries, left them with some wisdom.
It did.
Talking about Sierra Leone and how they're handling it this time.
Ebola did. And again, I would argue that in this country, HIV did. Because people took it for granted. People ignored it. And then people died. Well, one of the things I found fascinating, given my neck of the woods, the place I come from, was that you would have cases of a family member who has died, in this case a husband, and the cause of the death is known. And the status of the wife is also known. And you still find inheritors queuing.
They want to inherit the wife.
Yes, and inheritance means having sex with them. And in many cases, it means having unprotected sex. And I wondered, what madness is this? And indeed, give it time, you'd find that the inheritor has passed away. That woman has also passed away. And you'd find even more tragic in cases where someone was already polygamous.
Yeah. So the inheritor has other wives.
So you start finding people in that family just passing away one by, and it happened many, many times. Many times.
Let's get to a look at the headlines, starting with the Standard. City.
Well, the doctor's tale of life quarantine. As you see, I'm ignoring completely when this reggae stopped. Well, if somebody wants to come up with that one, you carry on and come up with it. There is something that is being spoken of on page 12 in our papers, and it's talking about the life of people who are in quarantine and what it looks like, being up close and candid. This place you call a quarantine, what is it and what does it look like, and what does it look like for those who are actually in there?
Yeah.
Okay? Now, we've heard of these isolation stations, and we've understood why it is we have them. And we've understood that there are people who've gone in there, and many of them have come out well. They went in positive, they've been tested at the time of release, and they found it to be well. But there are other details that perhaps have not come out. And page 12 of the Standard tells you of the mandatory quarantine is gloomy. And there's one individual by the name of Danson Macharia. Okay,
he's a medical doctor.
Yes, he's a medical doctor who tested positive for the virus, even though he has no symptoms. Yes. Now, why this is particularly interesting is that we always hear the cases of people who went in there just as patients, but not as service providers. Here is the story of somebody who is a service provider. And it opens your eyes to what they feel. But the thing that comes out of his story, medical doctors are just human beings. Health personnel are human beings. And when you have a situation where enough precaution and care isn't taken to guarantee the safety of health workers, then you start losing the fight against COVID even before you've actually begun.
Because
they are our soldiers, they are our leaders in this fight.
Yeah.
And we cannot afford to have a situation where they are also falling prey to COVID like everybody else. Because in so doing, we automatically reduce the numbers of our fighting force.
This story by Dr. Masikori tells a lot. First of all, Dr. Danson Macharia apparently had traveled back into the country from Nigeria. Then he went into the mandatory quarantine, the government-facilitated mandatory quarantine. He went into a hotel. They were tested at that hotel. He tested positive. He's the only one at that facility who tested positive. So he was taken into isolation, into treatment. Then the other people at that facility got an extension of their quarantine, all right, an extra 14 days because one person has tested positive. So Dr. Macharia now is telling the story of his journey from the moment he arrived in the country to going into the quarantine, to getting tested positive, to now receiving treatment in the wards. And he's saying, even the people around me, the other people who are also patients like me who have tested positive, some of them are asymptomatic. I'm here, I've tested positive, I'm okay. But it doesn't matter. He is still going through a lot of, mental anguish. He's there. He cannot leave the room. He's there by himself. You cannot leave the facility. You just people who are coming to serve you are dressed in these PPEs. So he's talking about the kind of state that you have to go, the mental state of a patient in an IDU, and he says it's not a joke, and that's why Dr. Masikori basically raises the issue of what to do for mental health during COVID-19 pandemic. Be empathetic to all those affected. Do not refer to people as COVID-19 cases, victims, or families. Reference should be people who have COVID-19. They are being treated for COVID-19 or they're recovering from COVID-19. Minimize watching, reading, or listening to news on COVID-19 that causes anxiety and distress. We were being told this by Dr. yesterday. Protect yourself and be supportive to others in need. It's because these are the issues that are coming out of the quarantine facilities. I also spoke to the lady that we spoke to earlier in the week, Shiko, who was waiting to get a new fresh test.
Yes.
Whose initial test at Mbagathi had somehow disappeared. So she got tested. Now she was released from Nairobi hospital. But she's saying, I was there for 4 days. It is not a joke. You go through a lot mentally. You're thinking, all right, so here I am. In fact, you've not even tested positive, but you're just feeling you're unwell. And she is a medical professional, you can imagine. She's saying some of the people who are coming to serve you, everybody who's coming into your room to serve you is wearing PPEs, fully wearing spacesuits. Fully geared up. And some of them, you think you know them because you went to school with them, but they're just looking at you and they're treating you like, go.
Can't be easy for sure. And it's definitely
one of the things that Dr. Macharia also mentioned is that his problem was particularly difficult because in his ward he was the only doctor. So now here you are acting as a patient because you are a patient, but at the same time as a doctor, you want to attend to your ward mate.
Yeah.
But the thing that seemed to have frustrated him most was the unpredictability, for instance, of the visit by the MOH staff, the manner in which the catering services were provided for. He says it's a buffet. He said,
it's a buffet.
It's written here.
Wow.
And he said that people are allowed to visit common areas. He said there was a complete lack of planning.
This was in the quarantine center?
Yes. And he said he wondered what guidelines and rules actually existed in this matter.
Yeah.
And remember, after they'd been in the Lantana Pride Inn, MOH officers only came in after the fourth day. So for the first 4 days.
But
it was
he
even
free
talks
for all.
about an earlier time when they were actually being shunted into buses. He said it wasn't as though there was any precise. People could get off where they wanted.
Yeah.
And the drivers also didn't seem to know what it is. I am going to take the view that a lot of these things have changed since. One, we don't have people traveling in from abroad. And I'm also assuming that even the places that people are being quarantined in, that the services have improved and that people are clearer about the protocols that one is required to observe when one is in such a place. I can only take that view. But it should be pointed out that with every problem that arises and with everything that is made known, that should be a reason for people to improve. Not to get their backs up and start whining and complaining as to why they're being... No, you're not being picked on.
Just improve.
Those of you who are in the Ministry of Health, you are not quarantined, so you don't know what it's like to be quarantined.
Okay. Those who are in quarantine are telling you.
This is so just happening. Pay a little attention to what they're saying.
Well, there's really no reason for them to make up a story. I mean, they're going to have to be there. Why would they make up a story?
We're hearing stories from many places, not one place. Yeah?
Exactly.
We've heard them from many places. It began with the government facility, Kenya Institute of Administration. We've heard it, or the Kenya School of Government. Tells you the age in which I grew up in. Okay. We've heard it from Pride Inn. We've heard it from Lenana School. We've heard it. These are just indications of the need to improve on what already exists.
When you come out of the traffic break, I'll tell you what Dr. Patrick Amoth has done. People have been in quarantine for 28 days, right? First 14, these people flouted. Another 14. Now he's extending it beyond 28 days in some facilities. I'll tell you which ones. It's 26 minutes to 7 o'clock. This is the Situation Room. It's Kenya's biggest conversation.
Not much happening this Friday morning on
Malindi.
Major roads within the country, not just the city of Nairobi, have a little bit of a hold up on Waiakwe outbound. It is the weekend, but still, let's see what that will come out to be. But it looks pretty good wherever it is that you look. On Mombasa Road, a little bit of it right around the SGR, considering that the road at the ICD is still being worked on. Apart from that, nothing major going on. If we do see it, we'll be sure to let you know. Spice of MKE, reach us on Twitter. It is a Friday morning and it's still early picking, so let's see what happens in about an hour or so and we'll keep you informed.
Spice up your life.
So, Dr. Patrick,
mature, intelligent talk every morning. Spice up yourself.
Topmost medic.
He's like the Surgeon General of the United States.
He's like the SG of the United States. So, Dr. Patrick Amoth, yesterday, being the 16th of April, wrote a memo to all heads of directorates, all in charge of quarantine facilities, saying, "It has been brought to my attention that even after the first extension of quarantine period, some of those quarantined in some facilities have tested positive for COVID-19 and have since been transferred to designated isolated centers. This in effect means that those other persons quarantined in these facilities are still regarded as contacts of positive COVID-19 patients. After thorough evaluation of circumstances, it was observed that those in the following quarantine facilities did not maintain optimal social distance and instead had close contact and interactions. 1. Kenyatta University. People quarantined at KMTC Nairobi Kanu hostels. People quarantined at KMTC Nairobi MG hostel. Kenya Water Institute and the JKU Art. These factors facilitate transmission and cross-infection, and therefore it's impossible to determine whether all those quarantined in these facilities are actually safe to be released into the general public. This is therefore to inform you to communicate to those quarantined in the above stated facilities that their mandatory quarantine period shall be extended by an extra 14 days. Further, they are hereby directed to observe all the advice in social distance, hygiene measures, and to limit interactions during the period after which a repeat testing for COVID-19 shall be undertaken. All other support services will be maintained, and my staff will be available for any inquiries and support as before." 28 plus 14.
I don't understand something here, if I may. I have to lift up my hand
Yes.
when I ask this question.
Yes, Muga.
What Muga doesn't understand is this. What exactly are the protocols for these quarantine places? Because if you're in quarantine, this subject of co-infecting others should not really arise if you're really in quarantine, should it? So if you're in quarantine and it arises, then where are you? Are you really in quarantine?
No, you're not.
Are you even really in isolation? And if they're being broken, then I'm asking the question again, who is supposed to maintain or ensure that these people actually observe the protocols that have been set in place? That is, if they've been provided with the protocols and if they've been told...
who is enforcing?
Yes, exactly. Because I honestly do not understand.
This is one case where the government is basically just trying to run away and blaming the other person.
They're shirking responsibility.
So yes, it's true that the people should be responsible. And if they're supposed to observe all these measures, social distancing and the rest, they have a personal responsibility. But the reason why they were being taken to a government-mandated quarantine facility is so that the government enforces these measures. Now, the government has not enforced the measures. 14 days, the first 14 days, some people tested positive and therefore they were deemed to be, all right, people who have come into close contact with somebody who has tested positive, therefore extend by another 14 days. Now, some more people test positive. Extend further?
Yeah, it's going to be in a state of continuum. It's not going to stop.
Some people can be in this facility for months.
For months, exactly. Look, this thing you can equate it to, you have children in a house. They know who the holder of the rules are. But if there are no rules and those are not being pushed at any one level, guess what's going to happen? They're going to do what they want. There's no enforcer of the rules. There's nothing that's going on. People are going to do what they want. They may stay within the four walls of that home.
Yep.
They may stay within the boundaries that have been allocated. But if there's no enforcement of rules, there's nothing that anybody is going to follow. We gave the example of China, right? And what they did with the whole QR code and all of this that they did. Do you think that they were silly?
At the door.
Yeah. Do you think that you are the one who gave us the example of somebody in a farm somewhere and a drone came and met him and just next to the drone was a vehicle and said, "What are you doing here? You're not supposed to be here." They could have told him to go home. But what did they do?
Escorted him home.
Put him in a vehicle, made sure he got home, got into the house, and then we're going to be monitoring you from there. They don't have to do that, but why do they do that? Because they realize that you're dealing with human beings who still have a freedom of thought, and they're able to do whatever they want. But because you know what it is that you're trying to achieve by keeping them in this quarantine, then there are certain guidelines that you're going to have to set and enforce. Setting of guidelines is fine. Without the enforcement of the same, it is going to be very difficult to achieve any kind of results. You think China didn't know that these are human beings?
Of course, China does.
They know. They said, yes, this is what we are mandating. But they still went further to
these measures are
that
in
they
place.
achieve the results that they want to achieve by putting these measures in place. You still go ahead and say, we know that we've kept you here. However, we are watching to make sure that you stay in. Not for the sake of watching, but we know what we're trying to achieve.
And the reason why we want to do this is because we do not want people to be infected.
Exactly.
It doesn't matter whether somebody is infected in this quarantine facility or at home. We do not want somebody who's coming here negative getting infected. Now, you cannot tell me that everybody in these facilities has been breaking the rules.
No.
There could be 1 or 2 or 3 or 17 people out of 20 who basically want to leave
doing what they're
everything that they're supposed to do. Maybe one person has flouted the rules.
What it tells you is that the government shirked its duties, and now they are doing the things that people who have shirked the duties and have been caught red-handed do.
Yes.
You blame everybody. And the truth is, you cannot blame everybody. If they were maintaining the protocols as they should, they would know those people who flouted the rules.
Yes.
They would know. They would isolate those.
These are the people.
Yes. The whole point of a quarantine is so that you stay there, among other things, and they determine your state, and you're tested, and if you test negative, you go home.
Yep.
That's how it's supposed to work.
Go home.
Yes. Now, this quarantine is for everybody. So even those who test negative are going to be quarantined yet again. Well, this one, they're cooking it.
Imagine.
They will see how it comes out.
Because what are you going to do? Like you said, you're going to have people staying in quarantine for months.
This is 42 days.
For your mistake.
Yeah, for something that you didn't do.
Is going to be here for 42 days. 42.
No, it's not right.
It is important to maintain safety. It is important to ensure that people are safe. But this is not one of those situations. This is where someone is actually determined to ensure that what they're supposed to do isn't done. And they're becoming punitive in their measures. And yet, all they need to do was ensure that the protocols were observed.
Yes.
Simple.
In the very beginning.
Yes.
Then, unfortunately, you're wasting... Look, the truth is you're wasting tests on individuals that you could very well use those tests on other people.
How do we even know that they're being tested, first of all?
Wow.
Whether those tests are actually going to
Then
come
how
in.
do we know? Unless somebody who's in those facilities tells us they've been tested as regularly as has been reported, I am going to suspend my judgment on that particular issue. Dr. Moth and his team are clearly trying, but they're not trying hard enough.
There's a complete breakdown of how things are happening here.
The problem is that it was never done right from the beginning.
Yes.
That's the problem.
That's it.
So you can't play catch up. You can't play catch up and then expect to achieve the same results as you would have done in the very beginning.
They're
It is
chasing
very
it.
They're
difficult.
chasing
Yeah.
it.
You can imagine somebody who started a race at the start and then a minute later you join. How will you ever catch up? You can't.
And as City is saying, really isolate, identify those who have flouted the rules. Put in measures to identify anybody who's flouting the rules. Put in measures and identify them and say, Ndu and City, you have flouted the rules. You continue with the quarantine.
Yeah, you should be able to
Eric, we have noticed and observed that you did not flout the rules. So, and you tested negative twice. Go home. And continue the self-isolation for further 7 days because that's a requirement. When you go home, still isolate yourself for 7 days. At home. But this is what they should be doing. Now, coming to tell people in these facilities have not observed.
Let's ask. I have to ask the question. So what did they do exactly? What is it that
they
added
did,
up
which
to
is now a
be-
flouting of the
What
rules
did
or
they
the
do?
guidelines? What were the guidelines in the first place? Then you start to have to
What
ask
did they
yourself,
do?
Yeah, what did they do wrong?
If, for instance, they are required to share facilities, all right? If they are required to share dormitory facilities, these are bathrooms and all. If they are required to go down and still, if they are getting served, their meals are still in buffet form.
Whose fault is that?
Whose fault is that?
Yeah, whose fault is it? This is the thing. There's a lot of work still that needs to be done. And then if you're finding people reinfecting themselves within the quarantine facility, that's a big shame.
You know, the real work here and do is not the running around. It's not the activity. It's the thinking. What you're seeing is normal government thinking and functioning.
Yeah.
This is what you're seeing. So we've given them a place to renew. And we've told them, okay, there's a nyinyi.
Kaini hapo.
End of story.
And you think your job is done.
We told,
And then you come and say, nani ameangusha hii? Nyinyi wote kaini hapo. You know, that mentality of punishing.
remember, these are Kenyans who are in their country. And they're being quarantined in their country.
And most of them are people who have basically come back home.
Yes.
And
And they have a home to go to.
And they have a home to go to.
And they have not really kicked a fuss about being quarantined. They've mentioned a problem
Others
they
are
have.
people who have basically been brought into these quarantine facilities because of having come into contact.
With
So they were picked up from their homes
Understandable also.
and taken there.
Yes. Now, when you do this, you know what you've gone and done? You are the one who's gone and mingled these people. Why is it that, okay, you say you have a situation, you take people to wards when they test positive. Isolation means somebody is HIV, somebody is
It's
COVID-19 positive.
positive.
If they're all COVID-19 positive, they're all COVID-19.
Yeah.
Now, the moment you don't isolate them, and we hear of a situation where people are COVID-19 positive being taken to a place where they are non-positive COVID-19, I am praying that this is not what's happening.
There's a lot of disjointed information that's coming out of these quarantine centers. A lot. It's 14 minutes to 7 o'clock. This is a situation of Miss Kenya's biggest conversation. Remember, you can download the Standard newspaper app from Google Play Store. And just one subscription fee, you get to access the Standard newspaper from wherever you are around the world. I'll also be giving you the numbers shortly of the people to call should you wish to get the Standard delivered right to your doorstep. Good morning.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise.
Yeah. You're listening to Spice FM.
All right. So
Mature, intelligent talk every morning. Spice up yourself.
Social safety net. The elderly and poor households will receive weekly payouts to buy food during the crisis period. Frontline staff, welfare package, including insurance to cushion medical personnel against negative consequences of the virus. So this was coming off of President Uhuru Kenyatta's briefing yesterday afternoon. Health workers, as the numbers of a case of those infected with COVID-19 rose to 243, the National Treasury has now set aside 2.66 billion shillings for the Ministry of Health coronavirus response for the next 2 months, as tough budget cuts sliced expenses in virtually all sectors. In a bid to address the coronavirus pandemic, Treasury also increased the recurrent expenditure, salaries and operations for Moi Teaching and Referral Hospital by 635 million shillings, while Kemri gets an extra 142 million. The government has also released an additional 8.5 billion to the elderly and poor under the cash transfer programs run by the Labour Ministry. The additional 500 million shillings was in arrears, and that has also been released to people with disabilities. President Kenyatta said yesterday these monies will be devoted specifically to cushion the most vulnerable and to protect our healthcare workers. This comes as the government is struggling to balance the budget in an economy disrupted by the COVID crisis. So some money being released. It would be good to see that the elderly and vulnerable actually get these funds that have been spoken of. But we'll see. He says, again, and I quote, these monies will be devoted specifically to cushion the most vulnerable and to protect our healthcare workers. So these are the two groups of people that the focus is on right now.
So the welfare for healthcare workers is mainly looking at medical.
Yes.
It's like some form of insurance for medical workers, right? To in the event that they fall sick, or maybe their family members as well. I hope it extends to their family members, that they are covered. They have medical, don't they?
Who, healthcare workers? Yes, they do. But now the problem is that we don't know if medical insurance then covers pandemics. That's the thing. So here you get some help. Here you get some relief.
So what? Look, if medical insurance does not cover pandemics, it doesn't start covering pandemics because you've given it more money, does it?
Well,
or you're not going to be paying specifically for this?
Yes, specifically for this. So there's a provision that is made specifically for this. And because of the fact that more money is added, then that is what it takes care of. The money factor is the reason why most insurance companies don't cover pandemics, because they don't know essentially how much they would need to spend, because a pandemic doesn't tell you when it's coming, it doesn't tell you how long it's going to be around, and it doesn't tell you how much it's going to cost. Some of these things are already prescribed for your normal, illness that you would walk into hospital for. You kind of know the range as
There's something I'm not understanding though here, right? I'm assuming that the president is talking about medical workers in public service, in the public sector. This is government medical workers working in government hospitals, right? So if you're going to Kenyatta, no, let's go. You're going to any government facility. Who are you paying your fees to? The facility and therefore the government, right?
Yes.
Why do you need insurance? Why can't the government just say, all right, so all our medical workers are going to be treated in our facilities, and we will foot the bills for that?
Part of the problem is the understanding that very often government facilities don't have the wherewithal to actually treat them. So you're given an option to go elsewhere where you can actually access the treatment.
But you fell ill because you were treating somebody in that facility.
Allow me to explain. You're talking about an existing condition. It didn't come about because of COVID. This has always been there.
Yep.
Now, talking about COVID, which is specific, then what you're suggesting as a solution would work very well. Simply make that declaration. But prior to COVID, these hospitals were in existence. And if you notice, one of the things that health workers complained about was their inability to actually do what they're supposed to do, simply because they were not facilitated adequately.
I get that.
Yes.
I get that.
So even if you had insurance...
As a country, when we are setting aside all this money to buy PPEs, to buy extra beds, to set up isolation centers across the country, is because we are looking at how are we going to treat people who test COVID-19 positive.
Yes, we are.
Right?
We've actually been given money specifically for
We are
that.
even hiring doctors, an extra 1 billion shillings to hire doctors so that they can cater for these people.
Yes.
Now, these doctors, the new doctors plus the old doctors who are working in public facilities, will be working in public facilities. Should they test positive for COVID-19, they'll require treatment. And most likely, they should be getting treatment from these same public facilities.
They should.
Right?
Yes.
Now, the cost of that is basically being borne by government.
Yes.
So what's the insurance bit? I'm not getting the insurance part. Because for me, insurance come to my mind that you're looking at an insurance company. You contract the insurance company so that if Dr. C.T. Muga falls sick, then the insurer will
Pay his bill.
Yes.
underwrite the bill. Why does it need to go through that process?
I think the understanding is that if whatever the person is suffering from goes beyond the capacity of the public facility that you have, you need to be armed with the option, and that's where probably insurance would come in.
But even then, just say if in the event some of our doctors require more specialized care, and this specialized care is available in private sectors, private facilities, we have entered into an agreement with the private facilities. The government is undertaking that we shall pay the bill of that doctor. I'm just wondering why we need to introduce a third party called insurer. Because there's a fee involved.
My friend, and if you talk about private facilities, there will also be a cost involved. There are costs involved, yes, in government hospitals, but those are absorbed by the government.
Yes.
Your query is a valid one, and I honestly do not have a direct response that would adequately explain what you're asking. Because insurance normally comes in. See, people have NSSF, right? NHIF, rather.
NHIF.
Yes, but they've also had insurance. Why? Because for the longest time, all that NHIF did was cover for the bed.
Pay for your bed.
Then they revamped it, turbocharged it, and gave it new wings.
It's true.
Which wings have since been clipped.
It's true.
But they were given. So essentially, NHIF was acting like an insurance.
Yes.
Now, arguments and discussions arose about it. They said, okay, not a level playing field. These people aren't being treated the same way as other insurance companies, and yet they are offering a competing service.
In fact, even during that same period, the doctors were getting covered by private insurance.
Yes.
Right? So the government identifies this is a scheme for our doctors, and we're going to give this tender to XYZ insurance company for covering this. Now we are at a point where you're saying COVID is a pandemic, so insurance companies are not covering COVID. All right. But we have doctors who require treatment for this pandemic, COVID-19. Why do we need to pay an insurance company? And yet, the kind of care that we're talking about is still going to be given by their fellow doctors in these facilities.
Listen, what is insurance going to do?
Yes, what's insurance going to do?
They already work in a hospital, and they're treating people.
Yeah.
So why can't they be treated the same way?
Why can't they be treated?
Why can't they be treated?
And if you're saying that you're getting insurance money for doctors, are you also saying that if anybody falls sick across the country and they go into government isolation facility, it is for them to pay the bill?
Actually,
We have not been told. For example, if I fall sick, right, I get COVID-19 positive, I'm taken to an isolation facility, I'm getting treatment in some dormitory somewhere.
Oh no, we know
Will
already.
I be given a bill
No,
by
no,
the
no, you
government?
won't. No, we already know that for if you are found to have COVID-19, if you're tested and you're found, if you go to any public facility in the country, the government is footing the bill.
So why does a doctor need to
why
extra
do doctors
insurance?
need to be given insurance?
Yes.
This is the question.
Maybe we
If
need
it's
to just
free,
ask,
it's free. The first person who gets it for free is the doctor.
Why don't we raise the question and ask somebody who is in medical service
To explain
this
it to us.
Because really, we're going to go around in circles trying to explain something we can't really explain because there isn't sufficient information to on this particular subject to go by.
All right. I know we're catching up into the hour, Eric, but I think it's important to look at the supplementary budget. It's now a major balancing act for CS Ukuri-Yatani. We spoke about this in a little bit yesterday.
Yeah.
Previous budget of 2 trillion shillings, a new budget of 1.9 trillion. And so there's been a reduction of 74.3 billion. Changes, and that's the total national budget. Changes to the recurrent budget of 1.22 million. The new budget now is 1.24 million. So there's been an increase in 24.3 billion. And then changes to the development budget, which we talked about yesterday, is that, some of these development agenda are not necessary at this moment. Cut them. And we've seen that the previous budget was at 782.6 billion. New budget at 683 billion with a reduction of 98.7 billion.
So this is a supplementary budget, right?
Yes.
Let's tackle it actually in detail in the next hour.
Yeah, we can look into that.
We'll look at the figures and what the implications of this would be. Remember, if you'd like the standard newspaper delivered to your doorstep, the bold and factual newspaper, if you're in Nairobi metropolitan region, call Anthony Mutunga on 0702 905 941. That's 0702 905 941. Benson Getao will deliver for those in Mount Kenya region and the coast, 0702 905 780. That's 0702 905 780. And for those in the Rift Valley and the Nyanza regions, call Mark Odhiambo on 0776 756 107. That's 0776 756 107. Remember, the WHO has said that it's safe to touch, read, and handle newspapers. And the standard has been handled by staff who have gone through wearing gloves, sanitizers, and masks to ensure that safety is safeguarded. This is the situation of Kenya's biggest conversation. We're coming to the top of the hour. Today's proverb, C.T. Muga.
One who causes others misfortune also teaches them wisdom. That person, those circumstances that cause you what you may call misfortune, are the same circumstances that actually imbue you with wisdom.
So everything that you're going through is a learning process.
It's a learning process. And how you manage that learning process and how you absorb it is what may actually make it wisdom.
Right.
Yes.
Coming up to the top of the hour, 7 o'clock. In the next hour, we shall look at the measures that were announced by President Uhuru Kenyatta yesterday to cushion the economy. Some cash transfer program that is being piloted in Nairobi. Some people are saying that they have received some money, 2,000 shillings. If you know somebody who has received that, please get in touch with us. We'd like to speak to them. This is the situation. It's Kenya's biggest conversation. Remember, our live stream is up. Good morning. It's 7 o'clock.
Today it is a quiet day on the roads from Mombasa Road, coming right past the SGR and then to the junction of the JKIA. Not much traffic going on inbound there. You'll take your very little time to get into the city centre. All right, it looks really clear from where we are. Thika Road is looking very good today. Very few vehicles on the road. It's Friday, getting into the weekend, and people are observing the rules that we ask them to, more or less. We'll see what it looks like in a short while, but for now, it looks really good. Spice of MKE on Twitter, don't forget.
This is The Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power, and Eric Latin, agent provocateur, the man in the chair, seasoned journalist, newshound, a man who
broadcasts on Spice FM every morning on 94.4 in Nairobi, in Mombasa 87.9, 102.5 in Kisumu, 96.0 in Nakuru, 96.7 in Eldoret, 90.9 Nyeri, Malindi 97.7. We live stream the show as well every morning on www.spicefm.co.ke. You can also watch us on Spice FM KE, Facebook, YouTube, Twitter. You can also join the conversation on Spice FM KE Instagram. Our number 0719 012 600. That's 0719 012 600. Cash for the needy, health workers in a tight budget, and now there's a supplementary budget that has been presented, and those are the numbers that you were giving us before we went to the traffic break.
Right. Before we look at tax measures and all of this and the 3-month waiver, maybe we should start off with that before we go into the supplementary budget. So the president has given county governments a 3-month waiver to the Kenya Medical Supplies Agency, KEMSA. So they've been they're allowed to purchase masks and personal protective equipment made locally, and this is across counties. So the national government will also support devolved units in the response to the crisis with an additional 5 billion to supplement their savings from the KEMSA waiver. COVID-19 Emergency Response Fund has received almost 1 billion shillings. The World Bank and the International Monetary Fund are among global lenders that have committed funding to countries including Kenya. So now looking at tax measures that also have been put in place, we already know that VAT was then reduced to 14%. And the government has scrapped pay as you earn for those earning less than 24,000. These already we know. So in addition to that is what we saw yesterday of the 3-month waiver to KEMSA. Now, if you look at the winners and losers in the new budget, infrastructure is the biggest beneficiary, while judiciary and parliament are amongst the losers. And we're likely to hear something concerning that, I'm sure, very soon. Infrastructure, the biggest winners. This is after the National Treasury added the ministry 44.1 billion shillings in a budget where a majority of other ministries, including health, water and sanitation, alongside the judiciary and National Assembly, have seen significant cuts in their budgets. So previously, the State Department for Infrastructure was at 193.8 billion, comprising 61 billion and 132 billion for current and capital expenditure, respectively. So the new estimates increase this to 237.9 billion shillings. And the increase is for payment of outstanding and pending bills. That's the most that they're looking at now. This is why the increment was... This is the lion's share of this increment goes towards pending bills.
Wait. So you incurred a bill that was outside the budget.
Yes.
Because that's what you're trying to say. How did you incur a bill that was outside the previous budget?
Because
how can you be
unfortunately,
budgeting for something that you've already spent?
Right, you spent
That's not budget.
You spent it, but if you want to look at it, if you want to look right at it, these pending bills, pending means that they were not paid.
Yeah, but they had been budgeted for.
They had been budgeted for, but not paid. So it carries forward and still unpaid, and you have people crying for bills that have not been paid, right? And he saw this and said, okay,
let's
people
start.
need to be paid. Start
When
from
we're
the beginning.
budgeting for this thing,
Yeah,
did we have the money or are we looking for the money?
Well, I mean, look, when the budget is made, by the time... No. Look, when the budget is made, what do they say? Where are we going to get this money from in many cases?
We understand that perfectly.
So in most, your full budget is not in hand.
Did we find the money or did we not find the money?
In this case, it's clearly said that they didn't find it.
Precisely. So why are you budgeting with money you don't have?
This is the question, and it goes towards saying that we shouldn't actually make a budget for money that you don't have. But you hope to get
we
it
know
along
what
the
we
line.
collect.
I think
I
this
mean,
morning
this
I'm just
debate
not
is on
understanding
you.
very many things.
Of your government.
I'm not understanding very many things. So there was a budget in the last financial year.
Yes.
For X amount of money.
Yes.
On the strength of that budget, you went and contracted and procured for services.
Yes.
The person you contracted delivered.
But
You did
didn't
not pay them.
So you
But you had budgeted, right? You have budgeted 10 billion shillings to procure these services. At the end of that, you have not paid this person. Now you budget an extra 10 billion shillings so that you can pay the people that you owed last year.
Yes.
What are we?
And you didn't have money to pay them before, so now you're now budgeting again. Is this what they call deficit budgeting?
So what you've done essentially is that you've then taken money from other sectors, right? Taken money that for them has still been budgeted. Whether you have the money or not, we do not know. So you've taken money from other sectors to put in this other pocket that will pay these pending bills for which you budgeted, but you actually did not have the money. But you need to look at the trend of the budgeting that has done in Kenya over the last...
No.
Why not?
Hold
why
on.
not
Wait.
avail the money? No, the point here... No, it's still on the math.
Yes, I understand.
This is the 10 billion that you have budgeted for.
Want
right?
to simplify this thing?
You have budgeted for these 10 billion shillings. You've procured services and have been delivered for 5 billion shillings in this budget, right? You have not paid this person. Just avail the money within this 10 billion shillings budget.
This is what I'm trying to say. That
But what you're doing now is you're bringing another 14 billion shillings on top to meet us up. That's not... I'm not seeing that.
Yes.
Do explain it, please.
This is the thing. And the way in which it has been budgeted easily over the last 10 years in Kenya, especially after Kibaki times, is that a budget has been done without the money in in the coffers.
Or not all the money.
Or not all the money in the coffers. So if a budget comes of 2.1 trillion, they will say, well, this is how much we have. And our intent is that as we go along, we hope that from this sector and this sector and this sector, we will be able to get money to fill this budget. A lot of times, unfortunately, money to make up the budget deficit comes from borrowing. All right? So you'll say, we hope to increase our tax bracket and we will get a certain, and you'll hear him say, oftentimes the CS will tell you, or whomever it was, the minister at that time.
It's the minister.
Yes, the minister will say, our intent is that from local and domestic taxes, we hope to get this amount. From international external borrowing, we hope to get this amount. So it is very rare that your entire budget, that the money is at hand at that time. It is rarely the case.
That's okay.
That the money is there. So it is
okay.
budgeted, and unfortunately hopes to get those funds. Hopes to get those funds unfortunately do not become the reality.
What you do then is, as you're rationalizing the budget, is you take money from other areas and you do not add a budget. You basically plug the hole in this specific budget. You have a budget
That's
item
the way
here,
it's supposed
10 billion
to be.
shillings, all right? In this 10 billion shillings, you've already incurred expenses for 5 billion shillings. You don't have the money. Look for money, put it here. Don't say that now my budget goes up to 25 billion shillings here.
That's the way it's supposed to be. But this is what I am telling you. It is never the case here. That is the way it's supposed to be. In an ideal situation.
No, even in this particular situation.
But it is never done. It is not done. That's what I'm telling you. It is not done. You budget on a deficit, money that should be used to fill in those spaces, it is not. Unfortunately, what was the one thing that any extra funding in the government of last year, if you look at the fiscal budget, if you look at the fiscal year, what was the one thing where any extra money that was mopped up was used to pay? Loans. So whatever you budgeted for, any extra money that came in was not actually going towards those pockets that you're saying should be filled where there was a deficit, because something else picked up the priority. It was not the case. So what you're talking about is an ideal situation, but it just did not happen.
I'm not getting it.
It didn't happen.
Yeah, it's okay. It didn't happen, but the budgeting bit of it is
much as it didn't happen.
Increase the budget. You run on a deficit. It doesn't mean you do increase. If you run on a domestic budget of 100,000 shillings, rent, food, school fees, transport, everything, you've lumped it there, and you have a gap. You don't say now for next year I'm going to budget with 200 million.
No.
You don't.
You look at what you budgeted for and you ask yourself, what don't I actually need here?
So what you are saying in essence...
If I owe my landlord X amount of money, I'm going to look for money from this other side to plug that.
In an ideal situation, if you had your thinking cap on, this would be what you would do.
And I believe that the Treasury
but
has
we are
some
saying
thinking cap.
this
so
has not happened.
Explanation that's not working.
It has not happened. Now, this is what you're seeing. It's clear. It's telling you that yesterday the president said that this extra money and where we're reducing, where we're increasing, is to make sure that we pay for bills which were initially budgeted for but were not paid for.
The president was reading what was prepared for him to read, and I'm sure an explanation was given to him that this means this. But what Eric is saying is something that we must consider, because it's gobbledygook.
We're all saying the same thing here, is that something is not being done the right way, and the numbers are not adding up.
We're not understanding what exactly.
But I'm understanding it perfectly well. It is clear.
That's what I'm saying. The numbers are not adding because I understand it. Look, telling us that there's always a budget deficit, we've known this. It's not something new. But they should also tell us at the same time.
And the purpose of a supplementary budget.
Yes, every single year. Without fail, there is money that is not spent. Every single year.
Or there's money that, in quote unquote, can be explained away towards things like corruption.
I'm not even going there. There is money that is never spent. If you listen to any Auditor General's report, believe me, there is some money that, if you look at money that was allocated, what was done, that money was not spent. Now, if you go into the details, is where what you're saying comes in. It may not actually physically exist, but it can't be explained as having been spent. Even if we understand that, what you're being told now still doesn't make sense.
It doesn't make sense.
Yes.
Okay.
What
This
we
is
know.
not the way it
Anyway,
should
so
be.
money is going into, so the money that has been allocated, a higher amount, 44 billion shillings allocated to the infrastructure budget. Basically, if you just take this on face value, is going to pay the pending bills.
Yes.
So these are the pending bills money will go, infrastructure. And there are other departments that have lost have seen some reduction.
The judiciary is
their
one,
budget.
and I've said like they're probably going to be up in arms in a minute.
The judiciary is okay. Is one of them. They're no longer meeting. So maybe some of them.
They start on Tuesday.
Yep.
So they're coming back, and they're going to give the guidelines in terms of what is going to be done.
Yeah. There's still social distancing and all. They'll have to work out a way in which they work. Also, Parliament. We've already seen. You've reduced travel, you've reduced a lot of things, travel allowances, sitting allowances, all those things are going. So therefore, the budget obviously also reduces. Same thing is happening there. But health is getting a cut. The health ministry is getting, how much is this? A decrease, a cut. Health is getting a 12 billion shillings cut.
Why?
Because there's no money.
This isn't the right time to ask where the money went, is it?
It's interesting because now health is receiving a cut of 12 billion shillings. 12
At a
billion
time
at a time when they
health
need it
is
the
in money.
most.
Okay,
Yeah,
so
health is getting a cut of 12
but there
billion
must be some
shillings.
logic behind it. So what's the logic behind it?
Don't get it. The presidency is getting an increase of 4 billion shillings. Culture and heritage is getting an increase of 193 billion shillings.
Correctional
193 million. Prisons are getting an increase.
University education getting an increase. Infrastructure, of course, we said that. Broadcasting and telecommunications. Crop development, cooperatives, all getting an increase.
There's some things that are still not clear in this particular one. However, now the other measures that the president was announcing yesterday include that piloting of the cash transfer, right? So basically, the board that was set up, the Emergency Response Fund that was set up, chaired by KBL MD Jen Karuku, is piloting how to give out cash to the most vulnerable, and it's already being piloted in Nairobi. And this is what the president was announcing yesterday, that there are already some families that will start receiving some cash directly onto their mobile phones, so that they can now go and decide how they want to spend that money on their most basic needs and their most pressing needs as well, food. Right. So this, I think, is a good idea to give people cash transfer. However, you also need to make sure that there's food available in the market. Like the example that you were given by the governor of Laikipia. What they have done is they have secured the food, and then they have also identified the people who are beneficiaries. They send the money to the beneficiary, and the beneficiary just goes to redeem. They basically just get something. You go and redeem from the shop. So the government is the one that has procured the food and organized for the food to come to your local.
It gives the individual dignity. It tells you that you have the ability to actually go out and purchase this. It's a good method. There are some people who are elderly and are infirm and cannot possibly move. Now, these ones may actually need the food taken to them. But the vast majority are able to do so. It is a good scheme, this one. It's a good scheme.
Give them money, let them go and buy.
It's a good scheme. Let them also decide what it is that they want to purchase. It's a good thing. Talking of giving people the power, for the longest time, research has been done on what it is that would be appropriate when you want to help people arise or move out from the levels of poverty that they are at. And many research projects would tell you what to do with that money. Literally all of them went belly up. But in recent times, there have been research projects where money has been given, they do not tell you what to do with it. Randomly selected, 100,000 shillings given to you. The success rate has been overwhelming. When they've gone to look at these families, they've found that they put the money to good use, and it's something that has staying power, and their lives have changed. They didn't tell them what to do.
Yeah.
Which means
don't tell them this, go and buy unga, 2 kilos.
Let them buy what they need. They know what they need.
Yeah. Or even they can spend the money however they wish.
Yes,
as long as they're also looking at it that if in the father, if I invest in this, then I'll be able to get more money.
Usually they have a very clear idea of what they need. They don't actually need it.
17 minutes after 7, this is the situation. Miss Kenya's biggest conversation. Good morning.
It's mostly sunny in Nairobi this morning. The chance of rain is quite high, though, later. Highs of 26 will be experienced mostly through the city. Nyeri, mostly cloudy at 17 degrees. Highs of 24 and lows of 16. Nakuru at 16 degrees is partly cloudy. Showers expected later on, developing into thunderstorms later. Highs of 24. In Eldoret at 15 degrees, it's clear skies this morning. 22 degrees the high, and lows of 14 with rain for most parts of the day. It's 22 degrees and mostly cloudy in Kisumu. 27 degrees the high with thunderstorms expected later on. In Malindi, it's 27 degrees and cloudy through the day. Showers expected early on. Highs of 31 and lows of 26. Mombasa, 26 degrees, is mostly cloudy. Thunderstorms expected later with highs of 29 and lows of 25. It's already showers in Dar es Salaam at 26 degrees. Will develop into thunderstorms later with highs of 29. In Kampala at 21 degrees. Showers expected later with highs of 26 and lows of 19. Johannesburg at 9 degrees. Clear skies all through today. Sunny conditions. A pleasant day. Highs of 21 and lows of 9. In Lagos, it's 28 degrees already and partly cloudy. It'll cool down a little bit with showers in the afternoon, but they'll experience a high of 33 and lows of 27.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah!
You're listening to Spice FM. Mature, intelligent talk every morning. Spice up yourself.
21 minutes after 6 o'clock. This is the situation on Kenya's biggest conversation. In the room, Eric Latif, Ndu Okowan, CT Muga. We are looking at what the president said yesterday, some of the measures that were announced by the president yesterday. Need to start cushioning the most vulnerable in the community, in the society. This is the social protection that we've been talking about. We know that the fund is now in place, the emergency response fund. And they have already started piloting the distribution of this money. And City, you were saying this ensures dignity. It's also good logistically.
It is good logistically. You know, when you give someone the ability to actually make a choice, you are conferring upon them dignity. And it is a good thing. It makes it easier for someone to get on with normal life when the situation that they were in, or the situation that was brought to bear on them comes to an end. They are able to pick up. You know, remember yesterday we were talking about this state of helplessness which has been conferred upon us. Our guest yesterday, the mental health specialist, told us very clearly that when you have a situation where you have conditioned people into always begging and receiving, what you've actually done at the same time is you've taken away from them the power to actually do things from themselves at the same time. So
they become dependent.
Permanently.
Over time.
Over time, they become dependent. So they have a problem. The first knee-jerk reaction is, why are we not being assisted?
Yeah.
Not what do we need to do. But this one is a stopgap measure that enables you to actually take charge. You have the money, you have the decision-making process, you take charge.
You know what you've been consuming on a regular basis?
You know, and you know what to do. You know how to conserve it. You know, you are left with those humane and life-offering decision-making processes. You can decide. And that activity is a good thing.
Why is it a good plan to roll out on all emergencies?
It is a good plan to roll out.
However, I think the issue of availability of the food.
It is a good plan to roll out under these circumstances. But if you have famine or you have flooding, unfortunately, you really need to go and take food directly.
You need to take the food
directly.
Okay.
Yes.
In this particular case now, because markets are still open.
Yes. These people are not disabled. They may be faced with a problem and some may even be unwell and may test positive, but they're not debilitated. So you want to give them that humane capacity to actually make that choice. It is a good thing.
What's the difference between now this one and the Laikipia one? The Laikipia one is where the government is putting together a care park and deciding this is what we want to do. We'll put together a care park. The care park includes food, mafuta ya taa, mafuta ya kupika, in some cases, whether it's women, sanitary items. And then this is distributed through the shop networks. And then city, you're told, here, this is your coupon. Go and redeem this coupon at Mr. So-and-so's shop.
The idea of coupons has worked in many places, even in the Western world, by the way, where if people are in an economically disadvantaged position, some coupons enable you to get a huge discount. Some coupons, and you actually cut out of the paper, enable you to actually acquire something. It's like an advanced bonga point system where those particular bonga points which are given to you enable you to actually purchase things. There are people who you really have to give those food items, even in these circumstances, because of maybe the state of infirmity, maybe the distances that they live from where they might get the resources. There are details that actually indicate that it will not fit everyone. It is a good scheme, generally speaking, but you have to tamper it with other things to fit into other people who they may be a minority, but they may not necessarily fit into it.
Yeah.
Yes.
So this fund then, nationally, it will not do just the one thing, not send money. It has to also look at in other areas, this is what we need to do. We need to ensure that we are sending food.
Yes.
Actual food.
Yes. There are places you may need to even send food and some money. The place where sending the money is adequate, they'll know what to do. There are places where you have to just give them food. So you have to determine. You see, the problem we are discussing regarding quarantining and isolating people is this. The lack of specificity into explaining this is how we're going to do it.
Yeah.
If you test positive, we know you will be taken to hospital. Isolation, we understand. But this quarantine, who do we have in quarantine? And how do we maintain the quarantine? You see, these questions are arising because of an absence of this clarity of protocol. I'm sure the protocol exists. That I don't doubt for a single second. But how it is managed, how it is enforced, that one, no one has responded to date. We don't know how it's being enforced. When we've talked to people who are in these quarantined establishments, they tell you of what happens. And the thing that is clear is that enforcement we're talking about doesn't exist. Even if these are adults and they're supposed to make the decisions, believe me, they need someone to oversee this process. You have to. If you want it to work, you have to. It's the same thing with the curfew. You can't have a curfew and then tell people, please make sure that you're home at 7. They will not be at home at 7.
There has to be some enforcement.
Yes, they will not be at home at 7 for sure. Remember that first week when they tried? Okay, just try this. People were just getting on with their lives as usual. They were not adhering to anything.
Yep.
And that's why they said, okay, shut it. Now, you've been able to enforce. Now, they've been a little too enthusiastic with the enforcement in some cases, but the enforcement is there. In fact, that there is enforcement is why we see the enthusiasm.
Yes.
But there has to be. Now, in such a case, there will be a plan that generally, people receiving money is a plan that works well. But there are others who you do well to actually give food. There are others you do well to give some food and also some money.
It will also be interesting to see how the national fund works with the county governments. The counties are already mobilizing. We've already spoken to, the governors that we've spoken to are all mobilizing at the county level.
And I think they began this also before waiting to see what the national government was going to do. Now, it would be interesting to know if they're going to be able to work in tandem. Clearly, the national government has to have this double-sided approach to how they're going to deal with this thing, where we talk about, giving food in some cases and giving money in some cases. Munya says, however, that the state will send money to poor families directly, and they're moving away from a culture of storing food. He doesn't want Kenyans to believe that there's a shortage of food in the country. So the money that they're sending to you, you would essentially be able to go and buy. Don't think that there's no food in the country. They want to see now a merging of the national food reserves as well as the national cereals board. So they will see that the two will come together and will be merged.
It's in the future.
It's in the future. They want to see that.
Can we then skip it and move to something else?
Can we do something current?
So
these future things now.
Future.
So basically what he's saying is that they want to move away from storing food in that sense, but giving, assurance to Kenyans that this money that they are sending... We
want to plan this and we've started with this.
But this money that they're sending to Kenyans, that you don't have to worry that you'll be able to go and buy this food. All right? But I do think that there needs to be a double-edged approach to this because in some cases...
So what exactly is he saying? Just break it down for me. My understanding is a little wanting today. What exactly is the Minister for Agriculture
Munya is saying, we are not going to bring you food. We are going to send you money.
Simple, we've understood.
That's what Munya is basically saying. We are going to... But that's what the president was saying. Government has left... The government has suspended the distribution of food to vulnerable households, saying brokers have taken advantage of the program to exploit the needy.
He has a point.
Agriculture CS Munya says many of the intended households have not been getting aid. He says the government has instead come up with a strategy to bypass the cartels by directly sending money to the needy families electronically. The households can then make a decision on what to do with the money, according to the minister.
Let's see how this one works, shall we?
Just send the people the money, let them decide what to do with it. Now, that's a good thing. However, just like we've seen with the fund for the vulnerable and the elderly, this money is not sent on time.
People don't receive it at...
The president spoke about an increase of 10 billion shillings 2 weeks ago. They still haven't received. Now, yesterday, he brought it down to 8.5 billion shillings, which, by the way, it's still not clear. Is it 10 billion? Is it 8.5? For the same group of people.
Who in the past have been promised the same amount, and they get it's delayed. It's
What? You're looking for the words?
No, I'm not looking for the words. I've gone into La La Land and wishful thinking, and I'm thinking, can't one of these things just work as they're stating it?
What if?
Yes.
Just what if it worked?
Can't we just
and
be
it just
told
worked
that
well?
all the vulnerable have received money and you're getting reports, and all of us have people who are infirm, people who are poor, we all have relatives.
Yes.
Can't we just be getting reports that they've received money and that they're happy?
The
and they
decision
can do
was
this
made
thing?
and
Yes.
it has been rolled out.
Yes.
The point between decision being made and the thing being implemented is where the problem always
Even
comes
casting
in.
aspersions and doubting is tiresome. You get tired of always casting aspersions. But if it isn't done, then you must call it out and say, look, this was said would
And
be
it's
done.
not
It has
happening.
not done.
It's
What has
not
happened?
happening. What's wrong?
What's wrong?
going
What has
on?
happened? What needs rectifying here?
Join the conversation on our social media platforms, Spice FM KE on Twitter, Spice FM KE on Facebook, Instagram, and YouTube, where we are live streaming. Also, you can call us in 0719 012 600. That's 0719 012 600. The measures that were announced by the president yesterday, cash for the needy. How is this going to be done? How is this social protection happening? Is it across the country? What are the other governors doing? Is the national government and the county governments plan in sync? We already know that some of the county governments have raised money. 001 Mombasa has raised a lot of money. And today, I've seen that Joho is going to be having an online donation campaign on Facebook between 6:30 a.m. and 6:30 p.m. and 8:30 p.m. We'll talk about that shortly. It's 7:30. Good morning.
All right. Not much traffic. Somebody says the matatus are doing a good job of maintaining social distance because there's very few on the roads this morning. There's an accident near Prestige on Gong Road, the junction heading towards Yaya Center and Kibra. So you want to be careful if you're approaching that area. Waiting for emergency services to arrive and sort that out. Okay, so getting out of the county of Nairobi seems to be a thing this Friday because quite a number of people held up at the roadblocks and again wondering why. In this case, specifically off of Thika Road, trying to get into Thika town. You're not allowed to go, folks. I don't understand what we need to say, but all right. So there's a problem today getting into Thika town, and people want to get into Thika town. I think they think that this is okay for the weekend. Because this is where we see the major problem. Yeah, well, this is what we're seeing.
They haven't fully understood what this lockdown is all about, isn't it?
No.
You can't move out.
Not from Monday to Friday. Come Friday.
No. You can't move out completely.
You and I understand that, but people believe that come Friday you can go.
We can.
And then Monday
You come
You
back.
come back,
back.
and maintain the...
yes.
But then what's the change? That's what people have been doing from time immemorial.
Voila. Spice FM KE, tell us what you see. We'll keep you updated. Let the minutes tick by, and then we'll give you more information about what the roads look like.
Spice up your life. Mature, intelligent talk every morning. Spice.
Nairobi.
And where is the roadblock?
I don't have those details, but they're just saying that they're trying to get in to Thika and they're not being allowed to.
The roadblocks are at the boundaries of the areas. At Chania River, remember Chania River is the boundary of the Nairobi metropolitan region, right? So it's at Blue Post, past Blue Post. You can actually even get into Blue Post if you wanted to. But past Blue Post, that's where the roadblock is. And if you're going towards Mwingi and Garissa, just after the junction of entering into Thika town, that's where you'll find the next roadblock.
Somebody's on the road, Eric, and is trying to get in, and they're not being allowed to. So
okay, wherever they're coming from outside the boundary, probably. Probably. That's where the issues are. So Governor Joho of Mombasa is launching something today. Remember, we spoke to him last week, and he was talking about the kind of work that he's done in trying to mobilize resources to help the most vulnerable. Mombasa County having some of the officials there saying that Mombasa County has over 60% of the population that is vulnerable. And that's over 1 million people. Joho himself told us that they're looking to help over 200,000 families, households, coming to about over 1 million people. So today, online donation campaign is being launched by the governor live on Facebook at Ali Hassan Joho between 6:30 p.m. and 8:30 p.m. He'll be launching this campaign on how you can donate to help the needy. This is what they've already come up with, even with the website, mombasafoodrelief.org.
As much as I think that national governments and county governments should work in tandem, I really do appreciate the approach that certain county governors are taking to go ahead with things and not waiting for whatever it is that the county government is going to say, the national government rather is going to say or do when it comes to these things. And I do like the approach that he's taken, is that there's so much that he has done already, and that's so much that he plans to do, and he's not saying, okay, hold on, there's been an announcement from government, let's wait and see what's going to happen. But continuing in these efforts and to go through and saying, well, regardless of what we get from national government, that will be an added advantage for us, but at the same time we're going to continue this work which we started out to do. We're going to go ahead and make sure we complete it. And we always say development begets development. So if we see this happening, it's likely and hopeful that others will follow suit when it comes to this. I dare say that things get harder than they already are, that the people of the county who are the most vulnerable will not have a problem when it comes to accessing, at the very least, food.
Yeah. They should have an easy time. So we are waiting for your phone calls. Well, we are opening up the phone lines now. You can join the conversation. 0719-012-600. That's 0719-012-600. The vulnerable are getting assistance across the country. What are the counties doing? If you know what your county is doing, and maybe the governor has not come out as openly and strongly to talk about it, it's also something to talk about. Now, medical workers are also, like the president was saying yesterday, frontline workers, let's also work on something to cushion them. Remember, there has been a back and forth between the SRC, the Salaries and Remuneration Commission, and the governors. And the chair of the SRC has come out again to say, look, we need to have a risk allowance for our nurses. And the SRC, you need to get with the program, all right? Work with us here. Governors have started to push to have doctors, nurses, and other health workers in direct contact with coronavirus patients paid an enhanced allowance for the risk that they encounter. The Council of Governors is urging the SRC to approve the request and the newly formed National Coordination Committee on the Corona Pandemic to set aside more resources for the allowances. The nurses are the more exposed workers in hospitals, being the first contacts with those infected with the deadly virus. Now, this is a conversation that is starting, is stopping. If we are in agreement that the frontline workers, nurses and security need to feel appreciated, let's have that conversation. Should they be getting an extra allowance, though? I am having two voices in my head.
An extra allowance because of COVID? The assumption is that they're doing extra work through all of this, getting extra training and more that they should learn on the front lines.
This battle they fought before, huh? When they wanted uniform allowances raised to a certain level. They also wanted allowances that caters for just the nature of their work and the odd hours they keep and stuff like that. That debate should continue on this particular one. There are countries who've actually done precisely what we are discussing here. They have clearly come out and said, health workers, Even if salaries will reduce, you won't. In fact, forget reducing. We'll
add yours.
Given what they're doing right now.
For this time, for this period.
Yes, exactly.
So get an extra allowance for this period because of
just
what
for
you're
that
doing.
period.
Just to appreciate you, to acknowledge that
what you're doing
is going above and beyond. Putting in extra hours. They're going to be expected to put in extra hours, of course, in coming days. So this is that.
There shouldn't be a debate on this one, should there?
When we send our soldiers to war, should we do the same? In this particular period, because you're at war.
When you consider that
you're out of the barracks.
It is true, but remember, being in the barracks is the anomaly here. Soldiers are actually not meant to be sitting in barracks and getting fat. That's not what they're supposed to be doing.
Oh, so even doctors treating patients is normal.
But a war is a war. So are you saying that if people are coughing, this is what they do? This is now a pandemic, something that you had not foreseen, something that is affecting more people. You're being acquired to even utilize skills that you didn't have before.
Same argument, I would say. When you send your soldiers to war, specifically to war, we've sent our soldiers to Somalia, to war, right? They're in the front line of this war. Should we also consider now giving them an allowance just because, well, you're a soldier, yes, you're trained, yes.
People who go on peacekeeping missions
get an
are
allowance.
given that consideration. It's outside their normal duty. They're helping people who are already in a state of war to arrive at a state of peace. But this is, we fighting a war. We are fighting someone else.
Yeah, but we are sending them to fight the war.
You see, I would look at it differently. I wouldn't look at it as fighting a war. I'd look at it as an out-of-station per diem or an allowance. That's how I would look at it. Because if you are in the barracks and you're going through the exercise, because they do go through exercises to ensure that the skills are sharpened, that's fine.
Yeah.
But if you're leaving the barracks to go somewhere else or going to another country, it isn't as though you're being required to have skills that you didn't have. You're trained to fight. That's what you're trained to do.
Yes, you're trained to fight.
So this consideration for going out, what do you call it?
This is it. You've basically sent them to war. Just like doctors are trained to treat patients and to be ready for a pandemic, to deal with whatever ailment befalls human beings.
No, a pandemic is different because it overwhelms everything. It changes everything that you do normally. The thing is, it's not normal.
Just like a war is not normal, CT.
Eric, when people travel out of this country to go for meetings, they're paid per diems. It's considered extraneous circumstances.
But also, it's part of their duty.
Yes, it's the duty that has taken you there. And I'm trying to say, I'm not minimizing and saying that what soldiers do is not worthwhile. I am saying find a way of calling this allowance. Call it something more appropriate, but don't compare it with what the doctors are doing. Because soldiers on a daily basis don't fight. They sit in the barracks unless there's a war. Doctors go and treat people every single day. Medics go to hospitals every single day. That's what they do every single day. They don't sit back and wait for people to get sick. They go to hospitals every day because people get sick every day.
And in this case with the pandemic, I mean, you want to look at something like COVID. If you want to look at it.
Pause. Because Victor is on the line. He's calling in from Kericho. Victor, good morning.
Eric.
Good morning.
Yeah, morning, Ndu and Siri.
Good morning.
Eric, I would like to weigh in about the issue you are discussing of doctors.
Yep.
Being the frontline soldiers.
Yep.
I want to be with the city on this, that the health workers need some special allowances.
Mm-hmm.
And maybe to put peace between you and the city, that army officers don't get maybe some special allowances when they are out fighting. For instance, the ones under army from umbrella in Somalia.
Yep.
I want to put it clear that they get extra allowances from the army.
Mm-hmm.
So I think any other people involved directly as frontline soldiers in this fight of COVID-19 should get special allowances, including our police officers.
Right.
Yeah, they should get health workers, police officers, plus any other person deemed to be on the front lines.
They should get something.
They should get something. Even the provincial administration staff, the chief, up to the regional commissioners, they should get these special allowances.
So everybody who's working full time right now and is required in this should get something.
they should get something, you know.
For doing their work.
Not for doing their work. You know, these are special. These are a special unforeseen work that nobody foresaw this coming.
Yeah.
And in this case,
what is the chief doing that's extra from what they're supposed to do on a daily basis?
You know, I tend to see into it that chiefs like currently, you might even be called at wee hours of the night, even at night, sanane ya usiku, you're being told to mobilize some of these. Maybe somebody you've been tipped off that somebody has come from elsewhere, and you know some of these things, they happen, and these are realities on the ground. Yes, the police officers manning the roadblocks. So, you know, at least to listen up their spirits, you know.
Okay, I hear you.
Yes.
I hear you. Like I said, I have the two voices in my head. One is saying, all right, yes, let's acknowledge, let's pay them. The other one is asking, so if we start with this, where do we stop? If we say, yes, doctors and nurses, and now we've said security officers, and now Victor is saying, let's increase even to the Ngao, the National Government Administration Officers, the counties will also, so we also have ward administrators. Where do we stop?
I think he's given a good opinion, but let me take it back to the original discussion you and I were having. Soldiers go out to kill. That is what they go to do. When you are at war, people get killed, meaning kill as many of those fellows as you possibly can, disable them, make sure that this state of war ceases because we've overwhelmed them.
Go and defend us.
I summarize, I brought it to what you actually do. The defense doesn't mean we have a nice discussion across a wall and say so.
Yes.
No. People fight, guns are fired, bazookas are fired, people die. Okay?
Yep.
And that's why it raises the alarm. Now, when you die, or when you've been shot and you're injured, you know what you do? You go to hospital. Doctors aren't trained to kill people. They are trained to do or medical staff, medical personnel. They're trained to do the complete opposite. Now, this they do on a daily basis. Soldiers don't fight every day. My point, not minimizing what they're doing and saying they shouldn't be considered. No, I'm saying this is what they do. Now you have a situation where there's this new threat that no one anticipated and no one even knows what to do with.
No one knows, in this case, nobody knows what it is.
Yes. And you're being asked to deal with this over and above what you do normally. So that's where this consideration now comes in. The gentleman who called in from Gericho clearly stated it's something that I did not know. I didn't know that they're paid an allowance, but it's called uniform. Yes. If they're being paid an allowance, then it is good. I only knew that people who went on peacekeeping missions were paid. So if this isn't peacekeeping, we're actually fighting. We're at war.
And that is why I'm saying Kenya is at war with Corona. The president has said this himself. We are at war. The CS for Health has said we are at war. And we are saying our frontline soldiers, in this particular case, we're even calling them frontline soldiers, are our medical professionals, nurses, paramedics, doctors, everybody who's working in healthcare is our frontline soldier in this war. And who are we fighting? Not human beings, COVID-19, right? So they're being expected to do extra from what they do. Yes, that's fine. Even soldiers, when they're hired, just by having an army, just knowing that Ethiopia has 1 million soldiers is good enough for you not to even attempt to raise a finger at Ethiopia. That is already working. Let's take a break. 12 minutes to 8. Good morning. 0719 012 600.
87.9 Spice FM. Mombasa.
At 10 minutes to 8.
Mature, intelligent talk every morning. Spice up your
012 At some point before we picked Victor's call from Kitale, from Eldoret.
Was it Eldoret or was it...
Kericho, Victor and Kericho. Before we picked that call, Ndu, you were making a point.
I think he made the point, actually, because that's what I was going to say. In this case, that you have special circumstances in which soldiers are paid an extra bit when they're asked to do something over and above that which they've been hired to do. So in this case, if you want to look specifically at COVID, you know for a fact that a lot of the frontline health workers are dealing with something they've never seen before. They don't know what it is. And we're not just talking about Kenya, the world over. Because I was just looking at some statistics from health workers in the United States to those in Germany, to those in France, to those in China, had to go through extra training just to get an idea of what it was that they were dealing with. And they don't get a break on this. If you want to look at the NHS in the UK, for example, you have a nurse or a medical worker who is working in London tomorrow, and they're in Edinburgh and they're in Edinburgh the next day, and then they're in Chelsea the next day. They're being asked to move all over the country. There's no reprieve. There's no waiting in terms of the numbers. They're asked to go now, go do this. There's no rest. You turn over, you're done. You're going on to so there's extra hours put in for something that you've never seen before, for something that you don't understand. So I mean, the sums that we're looking at in this allowance that they're being given is not anything colossal, really. I think it's something that's a little extra to really appreciate the work that they're doing and to maybe give them some oomph to keep going for tomorrow. Because one, you don't know how much longer this thing is going to be around. Number two, you can only hire so many staff. What are you going to do when you hire out anybody who has any kind of qualifications? If that's possible. So you're going to have the same number of people.
But they've hired those as well.
Right.
Auxiliary workers to help with things that are not necessarily directly medical.
Yeah. Right. So then if you get to the place where you've mopped up everybody that can be mopped up and you still need people to keep going, you still need these guys working under circumstances that could get worse. And this is the thing, the not being able to know where you're going tomorrow, not knowing how numbers will grow, then I think it's only right to say, all right, taking all of these things into consideration, then maybe it's all right to give you a little bit of wiggle room when it comes to an allowance that you can have to, take care of something else because you have to be on the front lines all the time. In this case, you know what? There's no relief staff.
Okay.
It's you.
We will look at who are those that require that. Let's go to Kilifi County. Sammy, good morning.
Yes, good morning, everybody.
Good morning.
Morning, Sammy.
Yes, I would like to comment that actually I think this doctors, nurses, and whatever, they need not to be given any allowances since they signed that they should always be working in any conditions, be it in hardships and whatever. But after all, we normally pay them when there is no any emergency. Mm-hmm. So they should pay up at this time round when they are actually attending to these COVID-19 patients. They should not be emphasized that they should be given anything. What happened to the soldiers who actually ambushed the attackers? Also in the Westgate, nobody even gave them anything as a compensation, whatever they had done. So I don't actually support that.
How exactly do you compare the functions of soldiers, the functions of the medical staff?
They all
extraordinary circumstance.
No, they are not employed to deal with extraordinary circumstances. Not all of them. Doctors are meant to deal with illnesses. There's nothing extraordinary about illnesses. There's something extraordinary about COVID-19.
But it's part of it.
No, it isn't.
Look, are you telling me that doctors are not trained to deal with emerging diseases?
No.
Any emerging disease
is
an emerging disease.
No. COVID-19 is special in that what is not known about it is plenty. And when you say something has reached pandemic proportions, it means it is out of the normal, the numbers are out of the normal, everything about it is exaggerated, and that is what makes it special.
Yeah, but doctors are trained for that. I mean, the argument that doctors are not trained to deal with such issues.
No.
Let's say it's not COVID-19. Let's say it's kurupuko wa kipindupindu.
No, kipindupindu is normal. Talk about HIV when we didn't know what it was.
No, let's talk about kipindupindu, and it actually increases, and we have very many people.
But kipindupindu is known.
Kipindupindu.
It is known.
But you know what it is.
If we had
and we know exactly what to do with it.
If we had it, and we had very many people seeking medical attention for that, it would be okay for not to pay doctors.
No, but they already pay to deal with those things. They are known. When cholera first emerged and people didn't know about it.
We are not paying doctors because they don't know what they're doing. We are paying doctors because they are trying to treat patients.
Eric, doctors and medical staff are trained to cure people, to put it very simply.
Yes.
And these diseases that they cure are diseases which are known. When you have a disease that is not known, the first thing you do is train people again so that they understand what it is they're dealing with.
Train them.
Now, when it reaches pandemic proportions, then it's completely out of the normal.
Right.
Everything about your treatment and training, the rule book goes out of the window. It's something completely new. And that is why this consideration is being given, because the circumstances have changed.
There's an element of control that is lost when you introduce something like when a pandemic is introduced, because there are certain things you knew which flew out the window. There are certain things that you could normally control which also have flown out the window. You are not able to control because the rate at which it's infecting people with something that you still are not aware of. I mean, look at HIV that CT was talking about. Up until now,
it's a pandemic. It's a medical emergency.
Hold on. There's still some things that are still being found out, even till today, about HIV. The numbers are reducing, yes. But there's still some things that are being found out until today.
Yes, but it's not the ordinary doctor that's finding out. There are different people who are doing all this work.
It's still the ordinary doctor who's dealing with a patient who comes into hospital.
Eric, dealing with the patient.
There's the ordinary doctors.
Dealing with the patient is dealing with the patient. The people
then why do you have specialties, Eric? If dealing with Eric, why do you then have specialties if dealing with the patient is just dealing with the patient?
Exactly. So it's the specialties that we should be talking about. The people at Mbagathi IDU right now, if it's the nurses.
Do you think you have any COVID specialists?
Exactly. We don't.
We don't, because that's why we're saying. Because
so
it's
why
a
are
new
we paying
thing.
them extra?
It's
they
a
are
new
doing
thing.
what they were doing last.
Wait, Eric, what are you saying exactly?
They're not doing anything extra. Let's talk to Trevor. Trevor in Kisumu.
They're not doing anything extra.
No, they're doing what they do. They treat patients. Trevor in Kisumu, good morning.
I think we'll talk to Trevor and come back and say that you're informing people on a false premise.
Good morning.
Trevor, good morning.
Yeah, I'd like to contribute to the conversation you're having.
Go ahead.
I strongly feel that the doctors who are currently dealing directly with the patients with COVID should be at least given some extra, let's call it a motivation to actually put themselves in line. It's like the way you say it, when a soldier is in the barracks, you just paid your basic salary. When you're sent outside the country, when somebody attacks you, let's say for instance somebody attacks the country, you'll just be paid your normal salary as you're fighting. When you're sent outside now, let's say people are under AMISOM, your regular salary is still coming in, and then AMISOM also gives you your allowance. So as a doctor, you know it's your moral obligation to deal with a disease. But again, it's like telling somebody, go and play with the fire, knowing very well that it can burn you, but still, I'm not even giving you an opportunity to think about the possibility of you being burnt. Just go ahead, get burnt, and then you deal with it later. So I think they should be motivated by cash incentives.
So your premise is to motivate the doctors.
To motivate the doctors, and also to curb the situation of somebody else coming to compromise the doctor, especially when it comes to the incidents where, like I said last week, is an incident of natural selection, and they're being told the most productive people are the ones who are unwell, and then the most productive people in Kenya, majority of them are the poorest. So when it comes to offering medical services, it should be a first come, first served basis. But somebody will come in, maybe they need a respirator, and then somebody else who's rich comes in and goes like you, I'll pay you a bit extra to put me on the ventilator, let that person go.
Okay.
So at least you make them at least have that moral obligation by not being in a position to be compromised.
Thank you, Trevor. We hear you.
Right.
We'll have this conversation. Let the conversation continue on 0719-012-600. That's 0719-012-600. Should the frontline soldiers in this war against COVID-19 be compensated? And who are these frontline soldiers? Is it doctors, nurses, paramedics? Who else? The catering staff? The cleaning staff? Where do we start? Where do we stop? City Muga, as we come to the top of the hour, remind us today's proverb.
One who causes others misfortune also teaches them wisdom.
One who causes others misfortune also teaches them wisdom. Join the conversation on our social media handles as well. Spice FM KE, Facebook, Spice FM KE, Twitter, and Instagram. It's also Spice FM KE. Call in 0719-012-600. The Situation Room is Kenya's biggest conversation, broadcasting from Nairobi to Mombasa, Kisumu, Nakuru, Eldoret, Nyeri, and Malindi, and also live streaming on www.spicefm.co.ke and our social media handles. Good morning. It's 8 o'clock.
Going on the roads this morning, all clear from most parts of the city in Nairobi. Yeah, so I mean, you're able to get in and out as quickly as you need to. Not much traffic today. In case you do see something that we should know about, don't hesitate to let us know. Spice of MKE is how you can reach us on Twitter. Give us a call on 0719-012-600. But for now, everything looks very good.
This is The Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power.
So Dr. Alfred Mutua, the governor of
Latin,
Machakos County,
agent provocateur, the man in the...
Look, I am already promising my workers in the county, medical workers in the county, that we're going to get an extra allowance for fighting COVID-19. Now, the Council of Governors is asking the Salaries and Remuneration Commission to approve a request to have doctors, nurses, and other health workers in direct contact with coronavirus patients paid an enhanced allowance for the risk that they encounter. And this is what the chairman of the COG, Kakamega's Wycliffe Oparanya, says. Workers are faced with increased workload. They have to handle the infected and the affected. The council recommends that there is need for your office to determine an honorarium for frontline staff who are serving beyond their call of duty in this period. And that's the conversation we're having. Should we compensate frontline workers in COVID-19? The phone lines are open, 0719-012-600. Justus in Mombasa. Good morning.
Good morning, sir. How are you?
I'm fine, thank you.
And the rest of the team, they're also okay?
Good
We
morning.
are well, thank you. And how are you?
I'm okay. Now, there are two. I think that kind of like three things put in one in that honorarium.
Mm-hmm.
There's the idea of risk,
Mm-hmm.
like some sort of risk allowance.
Yep.
There's the extra hours, the emergency hours they are likely to work,
Mm-hmm.
and of course the idea of being insured. So in that conversation, I think we need to separate those three things and discuss their merits on each. For example, I know for sure the government has hardship allowance for people who are working in hardship areas.
Yep.
Yet they're the same profession, they're doing the same thing. It's only that probably the place is hotter. An example is Makuyu. You know Makuyu on your way to after Thika?
Yes.
There's a place inside there called Gititu, I think.
Mm-hmm.
Just a kilometer from Thika town, you are getting an extra 20,000 or an extra 15,000 if you are a teacher, because it's a hardship area. So if we use that same logic, then
and what's
we
the
shift
hardship in this particular case? The hardship is cost of living is higher.
Probably, but the circumstances, the fact that in those old days, probably even getting there is a problem. Even the teachers who teach in places like Mandera, it's not just about cost, it's about the circumstances. Because you may get very cheap food there, but it'll take you years before you see your kit and kin in Nairobi.
Mm-hmm.
So there's a whole consideration I think the government took into factoring how to arrive at those hardship allowances. The other thing is about the health workers, is about the idea of insurance.
we cannot debate I know we all accepted that the risk of exposure to these unknown circumstances. So probably we need to consider, is there a risk they are incurring, and in case of anything, what do we stand? How do we compensate for them? It's not about whether they are doing their job or not. It's what we are exposing them to. And I can assure you, no worker signed up for COVID. So even if we say they are trained for this, nobody signed up for this. Even as Sidi was saying, in the earlier days of cholera, you could have considered the same thing when the outbreaks were unknown. But right now, is there management tools for cholera? We don't have management tools yet in terms of vaccines, in terms of treatment for COVID. That's what makes this situation more risky. And lastly, it's about the extra hours they are working. Look, our leaders sit and get an allowance. Are they doing an extra job by sitting? They're not, isn't it? So if we take the same consideration across board, the health workers, honestly, the ones who are running up and down, deserve an allowance. And the question could be, where do we get the money? On a light note, where is Nairobi, your governor earning? And is that concoction working? Does it work? The one on social media. Does it work? Any prescription?
We don't know.
We don't know.
But Justus, if we talk about the healthcare workers, who are they?
I think they say the ones who are in contact with the patient, the ones who are in direct contact. So what we can do, if I was in their shoes, I'll have a graduated package. If you are the frontline emergency worker, let's say your risk exposure is this level, and therefore the allowance should be this level. If you are, let's say, a reception in the front office, as much as you are also likely to be exposed, your exposure risk may not be as high. I'm not diminishing the work of reception, right?
Yes.
But the point is, we cannot have a blanket one, because for sure we know health workers are dying across the world because of the risks and the exposure. And then lastly, remember where our workers began from. They don't even have the basic gadgets to handle those the risks, right? Then why don't we even include this allowance money to allow them to buy those on their own?
No, let's buy them for them. Provide them with what you're supposed to. The next thing you're going to say now, let's allow them to buy scalpels. No, provide what what they need to work. You need to provide
first. Yes. But also now, if you look at it like that, if we look at the angle of insurance, they also need that insurance. Even so, a psychological satisfaction that I'm covered in case of anything happened, my kids will be safe. We need that kind of. Let's look at it as a tool for them to operate optimally.
Okay. Good point, Justus. Thank you very much.
Thanks, Justus.
Okay. In Kisumu, let's speak to Okech. Okech, good morning.
Good morning to you, Mr. Eric. How are you?
Mimi niko salama kabisa.
Nimeshukuru. Na wengine kwa studio?
Hatujambo kaka. Hatujui wewe uko mzima?
I'm also fine, thank you.
Good.
Okay, now, Mr. Eric, I think we should always appreciate somebody for a job well done, even if it is their job. They do it well, you appreciate them. Because I think we live in a time, especially here in Kenya, we don't really perform well as a people, our government, various institutions. So when somebody does something and does it well, they should be appreciated extra for it. And just like Justus was saying, we should find a basis of evaluating this well done. So that we really appreciate them for something done. And if you can give me a little more time, I maybe should comment on something else about Donald Trump. You see, I've realized that many people, we generally don't have a problem with his methodologies. As in, whatever he says, it's always honest, but we have a problem with how he's saying it. He doesn't always front an idea because it is popular, but it is because he has evaluated it as a conscientious man and is now giving an opinion.
Give us an example of something that Trump has said which has been evaluated by him as a conscientious man. One example, please.
Even the one which he is currently claiming about WHO. Now, if you WHO. Now, if you ask me, I think governments world over should listen to him. And if there is any chance that WHO was complacent for some reasons, or that they covered up China's mistakes, I think that is something worth investigating by governments. Because you see, governments fund WHO. And I think Kenya should also join in questioning some of these things.
So, so what are you saying exactly? What is this thing that is well reasoned? He's questioning WHO.
He's questioning WHO, and my problem would be that everybody is bashing him.
It's his mode of delivery.
His mode of delivery, so may not agree with it. Personally, I may not have agree with it, but I think, provided he has raised an issue, let's look at how that issue is. How does it stand? Does it merit a threshold? Because they are very grave allegations which should be investigated.
Which should be looked into. Okay, thank you very much. Nabuliri in Nairobi, good morning.
Good morning, guys. How are you?
We're
morning.
fine.
How have you guys been?
We are well. Are you well?
Amen. Thank God.
Yes,
I'm well. Can't complain. I'm staying safe.
Good.
My contribution in regards to these guys who should be given extra money, I think it's business as usual. This is what they are trying to do. And there's nothing unusual with what they're doing right now. Just the circumstances have changed.
So the hours are extra, but they're trained to deal with patients.
Yeah, so I don't think they should get extra money. It's like now saying, for lack of a better word, an askari should get extra money because probably his hours will shift from midnight to maybe 6 o'clock. Or he prevented thugs from entering into a certain house. Does he get an extra money? No.
But the circumstances we're dealing with here are not normal circumstances. We don't
That I agree also.
Yeah, we don't always have COVID. And if the policemen are out in the streets, don't you think, for instance, that they are more exposed to COVID than someone who isn't doing the work that they're doing? If you are a medical worker working within a hospital, are you not exposed more to the possibilities of actually contracting COVID than any other citizenry?
Yes, you are.
But
And that's why we're giving you PPEs.
Yeah, thank you. We're giving them PPEs.
All right, and how many PPEs, for instance, do we have in this country to cover the health workers that we have in the country?
If there's any health worker who does not have PPE, do not go to work. Let's start from there.
But Eric,
If you're
it's
wearing
not a
PPE and you're
statement
going
that
to work,
you
don't
can
ask
make.
us for more money.
People who don't have PPE still go to work.
They should not be going to work.
And who is to decide whether they should
Who
go to
makes
work?
that decision about
Even
whether
they
they should
have
go
been
or
saying-
not?
Who makes that decision?
Even
Eric?
the individual, even they say, I'm exposing myself. I am required. What is it? What is the protocol? The protocol is, as a medical worker, you ought to wear PPEs when you're going to visit your patient.
There is no country
This is
on
the
this
protocol.
planet right now who can tell you that they've
they
had
have enough.
PPEs for everybody, and yet people need to be treated.
People who
so
are
they will
coming
be
in
exposed.
contact. People who are coming into contact with the patients are getting the PPEs.
Eric,
And those that
not
don't have enough
everybody has the PPEs. Those are the facts.
You see, you keep changing your premise of your argument, CT.
I haven't
now
moved,
your
actually.
premise this time is if they don't have because they don't have PPEs, we give them
But
compensation.
the exposure is greater. You are saying that the exposure is the same as everybody. I'm saying the only way they're protected is by PPEs. And I'm saying they're not enough.
Yes.
So if you remove even the argument of the PPEs, their danger is even greater.
And I'm saying that, and that's the reason why governments are working towards putting aside money to provide PPEs for health workers.
And while
That is a big
they're putting on this thing, people still go to work and are exposed.
So
Is that
pay,
it?
so you think that we solve that by paying them an extra amount of money?
Paying them an extra amount of money recognizes the danger that they've been put in.
And
The money
then-
doesn't do anything to protect them anymore. That's
Or
something you
less.
have to be very clear.
And it
doesn't
cannot be the
protect them.
premise that because they're exposed
Why not?
to.
No.
Why not?
You,
Doctors are always exposed to danger because they work in medical field.
No, they're not always exposed to danger.
Oh, really?
No, they're not. This particular disease that we have, this pandemic, because of its nature, exposes them to greater danger. What danger do you have when all you're doing is treating known diseases and whose treatments are known? The danger is what you call normal because you know what to do. We are saying we have something we don't understand. We are still trying to figure out what to do with it.
Yes.
But we also know it kills people.
Yes.
and you also know that the rate of infection is actually quite high,
Yes.
and that it is quite, in terms of the numbers, it is numerous. It is in its variety.
All that
it
is
is
known.
large.
Yes.
In this,
And
when
then
when you saw malaria, which at some point was the number one killer, why were they not being told to pay people more money?
You tell me.
because of the fact that it's something they knew.
So the premise
they
for-
knew
the
how
premise-
they knew how it killed. It had been studied. They knew all the little details. They knew what was meant to
And
treat
there's a
it.
cure,
And
not a
there's a
treatment.
cure
And
for
there
it.
we
There
go.
was
Cure.
a cure
So
for
your
it.
premise now at 15 minutes past 8 is
On
that
Friday, no
on
less.
Friday the 17th is that you want us to pay them because we don't know what we are dealing with. That's
no,
what you're saying.
That's what
no,
you
that's
are
what
saying.
you are
That's
coming.
what
That's what
happened.
you're coming up
What
with.
is
You are
the-
ignoring everything we have said,
This
and
case-
then
What is
you
the
summarize
basis?
it to suit your argument.
So you summarize it to suit the argument. You summarize it
we
the
are
way you'd
saying
like to say
this,
it.
the
Why do
nature-
we need to pay medical professionals an
Actually,
allowance?
I'm not
The
going to-
nature
no.
of this virus, the risk is very high. The risk of infection, by just mere coming into contact with somebody else, the risk of infection is very high. 3 weeks ago, before we even had an increase in the PPEs that were being used in this country, what did you see across county? You saw medical workers saying they were going to go on strike. They realized their responsibility in wanting to make sure that they're providing optimum health care. But at the same time, they also needed to be protected. They're not going to go home and sit down and not do their job because they don't have the protection. But they're saying the strike was not that so that they get paid more money. The strike was so that you get to understand the importance of them having this protective gear so that they continue to do their job. They realized the importance of them being there, but they wanted to be protected
And
at
the
the same
argument
time.
there is
now,
direct
this
protection,
virus,
PPE.
this virus, just like CT has said, around the world, you had a chief virologist in the United States saying the other day, we're going around, we're using these things at record speed, and we don't even have enough. The argument would not be to go home and sit down because they have taken an oath. They have taken responsibility to want to provide medical care. They've taken that from the very beginning. We're saying at this point, enter in a virus which nobody still doesn't know anything about. But the things that you do know about is that the risk is extremely high for you to get infected. But because you know your responsibility as a medical worker, you're going to stay in the front lines. But what you're asking for is that you be protected a little bit more. You haven't seen people who want to say, oh, well, you know what? There's a lot of work to do. Dr. Mercy Korea was in the studio the other day and she talked to us. She says they're waiting. At some point, they too may be called. Are they going to shirk their responsibility or are they going to go?
They will go.
There's nobody else to go
They will
apart
go.
from them. You're not going to
Should
call
they
in
be given
engineers to come in
PPEs
and
or
do
should
the
they
job.
not be given PPEs?
That's
They
not even
should
a
be given
question.
PPEs.
Come on, Eric. That's
Yes.
not even
Eric,
a question.
The question is, do the PPEs exist
Do
to
they
be
exist
given?
in the
to be
first place?
given?
Are they enough? We have
So in
CS Betty
in the
Minor talking
absence
the
of
other day. We're
PPEs
trying to make more.
So in the absence of PPEs, we give them an extra allowance.
All right.
How
They
does
were
that
doing
solve
their
the
job
issue?
anyway when they were not
If
there.
our soldiers don't have guns, do you think they're not going to be called to go to war?
So we give them an extra allowance because you don't have a gun. Here is 200 bob.
It's not about making it happen.
No.
It's
That's
not
what I'm
about
saying. The
no. It's
premise
not
of your
about
argument.
no.
Allowance, not
It's
for
not
the gun,
about
Eric.
making it happen. It's not that we give you an extra allowance so that you can go and purchase a PPE somewhere.
What
it's
is the
about
justification
acknowledgement.
for the
It's
extra
about
allowance?
the acknowledgement that taking in the risk,
responsibilities that you're
still
taking.
the responsibility to do your job, and it's an acknowledgement of that.
So we're acknowledging that you're taking the responsibility to do your job.
In an instance
That
where
is the
you're
basic
in an
basis
go through to the end, Eric. Don't stop at a point where it makes you satisfied. Where it makes you satisfied.
You're not.
Take
You're-
it to the end where you say, in an instance where you're dealing with something that you still do not know the nitty gritty, the intricacies of. You're going in blindfolded and you still
And what
don't
you know
but
is
you're still
scary.
going.
What you know is already
it's
scary.
You could die. But you're still going because you're saying the multitude of people that I still have to treat, my responsibility, I'm still going to do that. The allowance is not so that you can feel better or feed your children. It's a recognition of the fact that despite all of this that you do not know, it is you that we are sending to do that because nobody else can
Call
do
it
it.
overtime if you want to simplify it.
If you want to call it that, call it that.
0719 012 600, 18 minutes after 8.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise.
Yeah! You're listening to
Only partly
Spice
cloudy
FM.
conditions in Nairobi today. It'll be mostly sunny at most parts of the city, and then we get into an episode of rain showers in the evening, highs of 26 and lows of 17. Nyeri is partly cloudy at 18 degrees today, showers expected in the afternoon, highs of 24 and then lows of 16. Nakuru is partly cloudy this morning, mostly cloudy conditions to follow at 18 degrees, showers coming in and scattered thunderstorms forecasted, highs of 24 and lows of 14. In Eldoret, it's mostly cloudy this Friday morning at 17 degrees, showers expected later, highs of 22 and lows of 14. Falling in line, Kisumu as well, experiencing rain showers later with highs of 27 and lows of 20. Currently, mostly cloudy conditions. Taking a look then into Malindi, where it's mostly cloudy at 28 degrees, showers expected later with highs of 31 and lows of 26. And take a look into Mombasa, where it's mostly cloudy this morning at 27 degrees, scattered thunderstorms in the afternoon with highs of 29 and lows of 25. And then in Dar es Salaam at 26 degrees, it's mostly cloudy conditions. Rain expected in the afternoon with highs of 29 and lows of 24. And taking a look into Kampala, where it's 21 degrees and mostly cloudy. Showers expected later on with highs of 26 and lows of 19. In Johannesburg at 10 degrees, it's mostly sunny. It'll be clear skies today rather. Highs of 21 and lows of 10. And finally in Lagos, it's cloudy conditions this morning at 28 degrees. Thunderstorms, rain showers expected for most parts of the day well into the weekend with highs of 33 and lows of 27.
Mature, intelligent talk every morning. Spice up
27
yourself.
minutes after 8 o'clock, this is a situation. We can use this conversation. 0719 600. Michael in Emoja. Good morning.
How are you, Eric? Morning.
We're fine, thank you. Are you well?
I'm not complaining. How about the others in the studio?
We are very well, thank you.
I'm not complaining either. I'm good.
Good.
Now, Eric,
Yes.
my contribution is let's look at this thing in a sober way. One, when we talk
Were we not looking at it in a sober way?
No, we are in a sober way, not complaining.
No,
I'm
thank
just
you,
saying,
yes.
outside there, we're just trying to look at it in a different way.
Mm-hmm.
Now, we want the doctors some incentive, which is not bad. But now, when you look at this thing in a Kenyan perspective, let me just start by asking, these incentives that we are now going to give the doctors or the medics, is it something that after this corona has passed that it will be reduced, or is something that will be in effect continue? That is one. Two, now, if we give these people the incentives that we are being told that because they are doing extra, do we have any information that these guys go beyond 8 hours? Because what I know from 2-3 medics I've talked to, they do their normal hours, then the others come to an extra shift again. It's not that they go extra shift. Yes, they may be called in case of anything. Okay, we have again the issue of curfew. Do we give also the policemen the same incentives? We say because they're going extra hours, they're moving around. It's their normal job, they normally go. But right now, they are going extra hours. Again, when we are talking of some people, they are saying this is a new thing. When the new curriculum came into effect, did we give the teachers some incentives? Because they are going for training, is a new incentive? Oh, let's look at it in that way, because at some point, Kenyans will start saying, when anything new will be coming, we need incentives from the government. That's what I want to ask, and also to get a
Thank you, Michael. Thank you, Michael. Yeah. So when does it stop? First of all, I think it's just an incentive over the period of dealing with the pandemic, and the pandemic is clearly when it's declared and when it's declared over. Or when even the government says, all right, so now we have treated the last patient of COVID-19 has left hospital or isolation facility, so we are done with COVID. But then, like Michael is asking, so what else makes it special circumstance?
Well, if he's going to use education as an example, at what risk were the teachers exposed? To what risk were teachers exposed to?
So it's about the risk.
And this is
All
what
right.
I've been saying this for the last 45 minutes.
Then let's continue with the same argument. The police officers who've been battling with Al-Shabaab in Kenya, in the northeastern counties, in Lamu County, in Tana River, do they get extra?
Do they? I think they should get a hardship allowance. I think they should.
First,
Do they?
No, there's hardship, and then now
to begin
there's...
with, the police should not be tackling Al-Shabaab. Because that's an aggression from usually outside the country, and that's why you have special units within government.
You have special units, special agencies that deal with external aggression.
Civilians, not that sort of situation.
So whichever security officer you deploy there to go and deal with these guerrillas, right? Are you giving them an extra allowance because of the risk they're exposing themselves to?
If you can determine the
number of police officers
beyond,
who've died in those three counties, just the three counties of Mandera, Wajir, and Garissa, is high.
It is going to continue being high simply because if you look at the details, you'd have to ask questions. These are people who are trained. Why are they always being caught off guard? What is it? If you're going to give the example...
Unknown. Everything else that you're talking about.
No.
You're dealing with an enemy that's not clear.
No,
it's not conventional warfare.
Eric, the experience...
It is not conventional warfare.
You know who the enemy is.
You even know how they fight. Perhaps we need to consider...
You know, a virus. Let's just talk to Duncan. I think you guys are just running off the track. Duncan, good morning.
Good morning, Eric.
Yeah.
Good morning, though.
Good morning.
Good morning, CT Muga.
Good morning.
Now, I've been listening to you, and I think, Eric, you've just poured whatever I wanted to say. You see, let's talk about incentives. When it comes to incentives, does it mean that when you went to school, you didn't know that you would probably be facing some challenges, which will be unknown and some will be known?
Mm-hmm.
So I'll give you, for an instance, Kenya Power, when they work overtime after their working hours, let's say there's been an outage, they'll be paid those incentives. So the same thing to the doctors and the nurses, I don't think they should be given. There are so many teachers who have been killed in Mandera and Garissa. Have their families been compensated? Were they being given incentives? So at the end of the day, I don't think the government should be wasting anything because these same people are being paid overtime when they do work overtime.
Okay, Duncan. Thank you. Robert in Kisumu, good morning.
Morning, Eric. How are you?
Salama kabisa. You well?
I'm well. Now, I would really like to contribute to this discussion.
Go ahead.
You see, Eric, it's very easy to sit from your point of guarantee and say that health workers who are exposing themselves to this virus that nobody understands are not supposed to be given incentives. Truly, the situation on the ground is very different. You realize even, health workers themselves, some of them do not want to expose themselves to this. There's nothing normal about this virus. One, people do not understand this virus. You realize that people actually right now work out of their norm because you realize you have quarantine centers and isolation centers. These are places that have been created specifically for this disease. One, this adds a workload to this disease. Nobody is working in this normal way of waking up in the morning, going to work, and then you come back in the evening, all working on their shift. A lot has been added on this. Apart from the PPEs and even the masks that we are talking about, you realize nobody knows how this disease, one can contract it. So I really feel bad when Kenyans, that health workers have walked out or have decided to go out of their normal working norms to work for them, still come and say that these people are not supposed to be given incentives. Incentive itself might not even match the work or the load that one, or even the exposure that one is exposed to. So when we are talking about this coronavirus, we really should have pleasant words for the health workers that we have outside here, because some of them are even listening to this. The moment now that we are going to say that these people are working, they're doing the job that they sign up for. I understand you well, Eric, when you say that when we start giving incentives, we'll have so many people coming up and now asking for incentives, like the police officers who are outside there trying to make sure that nobody walks out. But let's look at this thing deeply. I agree with City. we support that health workers are supposed to be supported throughout these activities. There's nothing normal about this virus.
Thank you, Robert. Yeah. Mwalimu Kamau in Dagoretti, good morning.
Hello, sir.
Hello.
Good morning.
Good morning.
I hear your voices loud and clear here.
Good.
Very good.
But I'm ranking COVID-19 so far. Because such a discussion could not have appeared.
Mm-hmm.
You know, it has been long, and I have been thinking about this for long. You know,
Yep.
It has been double standard in our country. Some of these things have been happening, and we wonder why are they happening? Ask yourself, Eric, what happens if an athlete runs in a marathon, wins millions, then come here in Kenya and added another money because he or she has represented the country?
Yep.
It does not make sense to me. You know, these health workers, yes, they are risking, and that has been the case since then. Even when they are being trained, I think they know this is one of the jobs that face a lot of risk in the world.
Yep.
And in this case of COVID-19, I hear what you are saying. Money is important, but also protecting them is very important. So as we are taking care of the money, let us also take care of the PPE, which is much important than money.
Important one.
For now.
Mwalimu, thank you very much. Mukoya in Thika, good morning.
Yes, good morning too. Assalamu alaikum.
Alaikum salam.
Good morning.
Nam, mine is to add on what you've been talking about. In that increment of medical personnel is a long-term goal than hike of, let me call it kinwamgongo, which might not be helpful in the near future, because when there will be, or when there will result another pandemic disease, there will be another, that will be a problem adding again their salary. Providing
so they should not get an extra allowance for this.
Yes. Providing protective gear is the best measure to end spread of any disease or virus. Another thing...
Mukoya, let me pick this other caller. Nicholas in Eldoret, good morning.
Good morning to you.
Good morning.
Good morning.
How are you doing?
Good.
Fine,
Very
thanks.
well, thank you.
So, good things you're talking about. But then again, if it's matters increment, I would be for the objection that if indeed it is meant for as an incentive, for instance, then I'm wondering, is an incentive given before a task is completed or after it is done? It is the precursor. It is given after it is done. So if the medical practitioner should be given the incentive, then of course let them do what they are tasked to do. You know, there are different codings and injunctions. So if we go for the do injunctions and don't injunctions, then of course we will be derailing from the divinity. Because of course, you know, if now the doctors are expected to do this, maybe the medical the various medical hospitals and other places that should address this pandemic are overwhelmed with patients. Now the patients have been given the motivation to do this work, which by virtue of right is what they expected to do, and they have not been given that. They will not be motivated to do what is their right, you know. And again, for instance, look, there are community health volunteers who are volunteering. They are not being paid, but they are also at risk of contracting this pandemic. Exactly. So it does not make much sense to say that others should be given increments, while in essence, the people who are also frontiers in this battle are not even being recognized in the first place. So the holdings of don't comes into place.
Thank you, Nicholas. Thank you, Nicholas. Frank in Umoja, good morning.
Good morning, Eric. Mwalimu Nduta, habari zenyu?
Hatujambo kaka.
Okay, sasa my contribution ni kusema walimu, the nurses and the doctors should all be remunerated in a better way. Instead of having this knee-jerk reaction of saying that we are now giving incentives. Because once we look at the people who are being given the better incentives in the country, it beats the logic. Because right now we're having a crisis. We have these corporations, or what do I call them, the secretariats that are not working and they are still getting the better salary, and these other people in the front line are not getting better things. So for me, I think this is a knee-jerk reaction, and the people who are in the front line are the ones who should be remunerated better than any other people, because these are the people we run to at the end of the day.
So for now, should they get an allowance just for this particular one, dealing with this pandemic? Should they get an allowance, and then we can continue the conversation of increasing their monthly pay later?
Sure, Eric. Sure, that is the best option for now. But later on, with this SRC commission should over change this thing all over together.
Okay.
Yeah,
thank you very much, Frank. Thank you.
Okay.
The conversation continues on our social media handles as well. Spice FM KE on Facebook, Twitter, and Instagram. You can call in 0719-012-600. Should the medical practitioners or professionals receive an allowance, a special allowance, for being frontline workers in this war against COVID-19? It is war. It is not business as usual. Even the president has said, this is not business as usual. It's war. Good morning. Let's take a look at traffic.
No, really, nothing. I think the roads are looking very good today. Interesting enough, there was a tree that fell around Westlands, and it's the next 2 days, and that has not been moved, just to show you that people are not moving in a particular direction, one way or other. So, apart from that, most of the other streets in cities around the country looking pretty good today, guys. If you see something out of the ordinary is when you should let us know, but now it looks pretty good. Spice of MKE on Twitter, not to forget.
Raise something that we have talked about before. So we have community health workers who are now going to be actually on the front line as well. And they'll be required to be the ones who help with identification, help with talking to people who call in or they think that they are developing symptoms of COVID-19. Should they also be added into this list? Because it appears like they're not. Some of them are volunteer health workers.
When you say someone is volunteering, the assumption here is that they're not paid. There are many volunteers who actually are paid. They're paid a stipend, it's in the salary. But there is something like a transport reimbursement or something to cater for your life. They are given something. Now, if you are talking about allowances that should be given, historically, even before COVID or anything that we're talking about, when people talk about special allowances and hardship allowances, this very government knew and acknowledged this a long time ago. That's why if you went to a resource-constrained area, that was called a hardship area, they gave you a compensation for being away from your family, being away from amenities you're accustomed to, and it was across board. Civil servants, not just teachers, it was everyone who worked within government. Now, if you look at organizations internationally, even now, there are people who are paid a certain amount of money or allowance for the very same reasons. We're not discussing something new. When it came to doctors, if you look at some of the debates that they've had when they've been pushing for more pay, it has had to do with this allowance that caters for the unusual circumstances they sometimes find themselves in, the uniforms that they require, considering also that doctors, apart from working in hospitals, have families to go back to. They live normal lives like others. So the insurance we're talking about might actually cater for that life that you have outside this particular hospital work, because that's just work. But if I take the argument further, if you consider what doctors actually earn, and you're talking about it juxtaposing the war situation, most wars are fought with people fighting each other. But when you have something like a pandemic, it's like fighting against drones. Half the time you don't see them.
They have an upper hand.
Yeah, they have an upper hand. You know the effect when they've dropped a bomb on you, something has happened. That's when you know. It's an uneven fight. And this is an even fight because we understand the nature of this particular COVID or this coronavirus because of its effects. And even as we understand this, we realize we still don't understand. It's these special circumstances that I think are now being discussed because these are special circumstances. They are not circumstances that we had before. And to answer your question, should policemen who are fighting Al-Shabaab, yes, they should be compensated because that's not in line with their normal duties. Policemen are actually supposed to manage civilians. That's what they're trained to do. They're not meant to be fighting bandits. That's not really their job. There are people who are trained to do that. And if the war goes on for a long time, should they be considered? The answer again is yes, they should be considered. If those special units who go out to fight these people, should they be considered? The answer is yes, they should be considered. Any circumstance that is unusual, out of the norm, and it puts your life in danger, there has to be consideration for that reality.
So teachers who are also sent to Garissa?
Yes.
Yes, they should.
It's just yes.
It's the same thing across the board. And I think we see this in different sectors. Bankers who have bank stations in those areas, those people earn something else. It's called a hardship allowance for a reason. We had areas in Somalia and South Sudan and Sudan where you had members of international organizations or even civil society organizations who went to work in those areas given a hardship allowance by virtue of the fact that they were in an area that was either war-torn or prone to aggression every now and then, and their lives were under risk. Now, when they came back to what they call a duty station,
back to normal,
the allowance was removed because they were no longer at risk.
Even in softer situations like you talk about expatriates, it means they've moved from their country of origin to another. They are paid an unusual amount of money simply because of, should we say, the inconvenience. Though I wonder what the inconvenience sometimes is, but there it is. All I'm saying is that these aren't circumstances. We're not discussing something that is new or something that doesn't happen. It occurs. Right now with COVID, it probably needs redefining, but it is justifiable.
Bosire in Mombasa, good morning.
Yes, good morning.
Good morning.
Good morning.
We're well, thank you, Bosire. What do you think? Should the medical workers be given an extra allowance for fighting COVID-19?
I don't think so.
Why?
The reason being, remember now, we don't have enough health workers. Why don't we employ more workers, give good protections, and then prepare for the pandemic that will come again? Because this is not the last one. What if we give them the allowances now? Another one is coming. Why don't...
we lost Bosire. Call back Bosire and finish your point. I think he's basically saying if you start now and then this pandemic is dealt with and then another one comes, Ebola, let's say, crosses over the borders and enters the country. And by October, we are talking about having Ebola again ravaging through the country. Also still pay an extra allowance to the doctors?
The answer is yes. It's not even complicated. These pandemics come to an end. And when they come to an end, people go back to what they were doing normally. Again, it's not strange. It's not new also.
It's not strange. And there has not been a pandemic on the globe that has lasted for eternity.
None.
Ever. It has never, unless this one is going to teach us something different. But of all, if you look in history, if you look at all pandemics that have greeted the globe, they have ended. So we're not talking about something in infinity. It is going to come to an end. And we're saying for a certain period whereby the risk is so high and you're swimming in unforeseen waters, come on, that's that's what we're saying. It comes to an end at some point. Finish.
You see, the argument from what I hear is we are talking about COVID as though it's something normal, and so we should treat it the way we treat what is considered normal. It isn't normal. That's just a simple fact. And the other simple fact is this. these abnormal circumstances that are being advocated for are the very things that help you fight this particular condition. And you see, it's not a remote control fight. It is a hand-to-hand, person-to-person fight. And that's why people's lives are in danger. So you consider all this in not just one group, expand it and consider everyone that you want to consider. There are special circumstances, make special considerations. When it comes to an end, that will also come to an end.
Bosira is back. Bosira, you were saying?
Hello?
Hello. Bosira. Yes, we can hear
Hello,
you.
I wanted to finish my point.
Yes, go ahead.
Remember, we have so many nurses outside that do not have job. I myself, I'm a nurse. I've not gotten an opportunity to be employed. Why can't we employ more nurses? This one will create employment to others. Also,
Bosira, the government is currently employing more nurses and doctors and other healthcare workers in different cadres.
Yes.
You're aware of that, right?
Yes, but remember what?
You're in Mombasa. Mombasa County already has made the announcement and asking for people to apply for the jobs.
Yes, we have applied for the jobs. But I'm telling you, the number of workers that have been employed are very little.
Not enough.
Only 27 nurses have been employed. But what are the number of nurses needed? Very many. You go to the hospitals. Remember when COVID came in?
Yep.
We had other conditions. So these other conditions are not attended to right now. Why? Because there are no protection. Because every patient coming to the hospital is taken as if this patient has COVID.
Mr. Busiri, I'd like to ask you a question. Of the number of nurses you know within the vicinity that you live in, how many are there, and of these numbers, how many have been employed?
I saw the advertisement of 27 nurses. Yeah, that is what I saw.
And do you know the numbers who might have been employed?
Yes, I have some colleagues of mine who have been employed.
How many are they in numbers?
I have like 4 of them.
Are you among those who are employed?
Yeah, no, I was not employed.
Okay.
I was not, yeah.
Okay. So it means there are more people out there who are qualified and could be employed who are not employed.
Who are still not employed.
Yeah, there are so many people outside who need self-employment.
How many years have you been without employment since you graduated?
This is the 4th year.
And what exactly are you trained in? Are you a registered nurse? Are you a community nurse? What are you?
I'm a registered nurse. Commented.
Okay.
Yeah.
Thank you.
Bosira, thank you very much. Let's go to Oduor Wafula in Nairobi. Good morning.
Good morning to you. I would like to make my contribution.
Go ahead.
We've turned this country into what is like just some sort of mediocrity. I don't understand how you can say that you are giving some people money because of doing what they are doing. One, if we, there are people whom we can acknowledge that these people need some money, maybe allowances because of hardship and all that. Say, for example, if you are employing teachers and you take teachers to places like, say, Turkana or away from Mandera, where there are issues of maybe insecurity, somebody will be wise enough and say, no, these teachers were not trained to fight Al-Shabaab. They were not trained to fight those other people. They are trained to be in class, but they are getting some other hardships. They are not able to get water. They are not able, so we can give them. But in this case, doctors are trained to treat people. If we talk of maybe the issues of like they are not safe, any sector, anything that doctor does in the hospital, but the doctor must protect himself or herself. Even just minor operation, the safety is all over. But these people are trained on anything related to health. So it's not just enough to say that we will give you money because you are fighting corona, and yet you are trained to do that. Just the same as what normally happens to MP. They are given, they add themselves money to do what they are employed to do. It doesn't make sense. If it's like security officers, police officers, you cannot tell me that you are giving police officers more package because they are fighting Al-Shabaab. Why were they deployed in the first days? To maintain security. What you can tell me that we are giving them because they have gone to a foreign country and they don't have enough material, so that it's like kind of, they can't get water, they can't get like other things, so maybe that way, but you cannot say that we are giving them because of fighting Al-Shabaab, because why were they employed in any case? It's because of that security. So I don't think.
Point made. Thank you very much. 10 minutes to 9. This is a situation of Kenya's biggest conversation. 0719 012 600.
Stop the spread of the deadly virus. But they cannot do it alone. They need the cooperation of every single one of us.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic.
8 to 9 o'clock this morning, we are taking a look at what's been proposed by the Council of Governors. It's being communication sent to the Salaries and Remuneration Commission, saying they'd like medical workers, health workers in direct contact with coronavirus patients to be paid an enhanced allowance for the risks that they encounter during the fight against this pandemic. Now, is it justified? Is it not justified? And the conversation here is whether it makes sense to pay an allowance or whether it doesn't make sense to pay an allowance. C.T. Muga and Nduoko are very clear on their articulation this morning. The doctors ought to be paid an allowance.
The health workers ought to be paid an allowance.
Health workers.
All.
Define health workers.
Anyone who works in the health field. Anyone.
Everybody.
Everybody who works, whether you're in the lab dealing with a specimen, whether you're the field worker who goes out to do community health work, all of them. Right now in these circumstances,
administration staff,
all. If you have a health system that is burdened with a pandemic, everybody is burdened. There's nobody who's spared.
Everybody is there on the front line.
Everybody is in the front line. And you will not say that one is doing something more important than the other because each one supports the other.
So if we, push that argument to its logical conclusion, as you like saying, do we also include the administration officers? So we are saying that right now there's a department that's basically whose job is to do contact tracing. They trace. These are the people who've come into contact with somebody who has tested positive. Let's identify them. Let's go and pick them up. Let's take them to quarantine facilities. Those police officers, chiefs and other national government administration officers?
Actually, the answer to this is yes.
People who are working in the quarantine facilities?
The answer to this, again, is yes.
So we're paying everybody an allowance?
You see, no, Eric.
Yeah,
I said health workers. If somebody qualifies as being a health worker and is in the front line, not everybody within a hospital will be working in a COVID area. That is the truth. Not everyone. There'll be administrators who just take care of the normal office business. When you have a pandemic, believe me, why do you train people specifically? So that they can focus on this. Remember, health workers, my emphasis, health workers. If you are what you call support and you are working with those working with COVID, yes, you have to be considered.
Because you are exposed. If you're a health worker, you're an administrative officer in this facility, you're exposed as well. You're working within that environment.
The hospital has an entire wing that just manages the hospital. They don't manage patients. They manage the functions of the hospital.
Yes.
They are not in direct contact with patients.
Are they coming into contact with the workers?
But there are some who don't even come into contact with the workers. They come into contact with paper. Now, there are those who come into contact with the workers. They have to be considered. Those ones have to be considered because they're exposed just as much.
Which is why I was taking us to those quarantine facilities. The people who are working in the quarantine facilities, the cleaners, the waiters and waitresses,
yes,
should those also be getting an allowance?
Yes.
At the quarantine facilities? People in Kenya Medical Training College, people in the hotels, Pride Inn, Lantana.
Yes.
As long as they're...
So long as you're working in that field, your level of exposure is higher than somebody else who is not working with that.
So you get an allowance for that?
Yes, you should. It's called a consideration.
This life of allowances is a lot.
Eric, your problem is that this money that we don't have, we shouldn't be spending it.
No.
Look, if you're not going to pay the allowances, then say we don't have money, then nobody gets the allowances. My argument is that the special consideration should be given. That is my argument. If the money isn't there, then it's a reality. It isn't there. But if it's there, then let it be paid.
We can't ignore the facts that there are certain people. Look, if this... You can't just pull anybody off the street to do this job.
No, you can't.
It is clear that there are certain people who already then have they have the mandate to deal with this by virtue of their profession. And these are the people who are holding the system together by virtue of the fact that they've been trained, they went to school, they've practiced, right? They are the ones that you call upon in this, because the question is, who else is going to do it? And here you have these people who are going to do this, again, working in unknown waters. They're treading in unknown waters. They don't know what they're going to find tomorrow. They don't know if there's going to be an upsurge the next week.
Nobody knows.
Don't know. Exactly.
Even those of us who are paying them also don't know.
Yes, but you're not there. You're not there at the front line. They are. You don't know.
The virus is not in the hospital. The virus is everywhere.
Actually,
it is everywhere. However,
but it is more likely to be concentrated in the hospital.
If you want to look at the very thing that they've told you, why should you not go to hospital? The first thing that you should do when you are suspected, you should not go to. There's a reason why they tell you not to run to the hospital.
So we don't
because that's the war zone. That's the actual war zone right there in there. And who are the people there who are fighting? It's not just anybody who can walk into hospital and say, okay, I want to practice.
No,
I think I can help.
It's people whose profession it is to fight.
Exactly.
So if those ones, that's their profession, that's their job. That's
but
what they're doing.
But in this case, in this special case, which I repeat is not going to last forever, in this special case, they're dealing with something that they don't know. So they have a little bit of information today, probably a lot more than they had 3 weeks ago.
In January,
however, it is not complete in what they know, and they're still working with things that they don't know.
In January, there's a nurse at Mbagathi Hospital who used to wake up, go to work, spend 8 hours at work treating patients. In April, on the 17th of April, the same nurse is waking up, going to work, treating patients. In this particular case, treating a patient with a new disease. And they are given special protective equipment so that they can treat this patient with this new disease. What are they doing extra? Tell me.
They're working within a risky environment. With the entrance of a disease of which they do not know. They don't know its origin. They don't know its life cycle. They don't know whether it's going to mutate into something different tomorrow. That's the thing. And again, it's something that you cannot touch. It is not tangible.
It is not only theirs.
It is not tangible. Yes, but they are the ones who are going. When you have a sick person who is not able to take care of themselves, they are the ones who are going to deal with them, and that is the point. That's the point.
All right, Siti Muga, as we come to the top of the hour, remind us today's proverb.
Today's proverb. My mind actually traveled very far away from that particular proverb. One who causes others misfortune also teaches them wisdom.
One who causes others misfortune also teaches them wisdom.
Yes.
Coming up to 9 o'clock, this is a Situation Room, Kenya's biggest conversation on this Friday, the 17th of April. You can call in 0719-012-600 and join the conversation. In the next hour, we'll be joining Dr. Mercy Korir, KTN's medical journalist. Any questions that you have to ask Dr. Mercy Korir, you can call, or you can also post them on Twitter and Facebook, SpiceFMKE, also Instagram, SpiceFMKE. Her individual Twitter handle is at Dr. Mercy Korir. Good morning. It's 9 o'clock.
Yeah, not much in what we're seeing today in terms of traffic. It's Friday where you normally think that there would be a lot, but with current conditions, current circumstances, not much traffic today. Unless it's something that I should know about or that you see that you could let us then know about, that which we'll in turn share. SpiceFMKE on Twitter. But for now, everything looks good. You should be able to get where you're going in good time. Remember though that in the evening, you must be home by 7.
This is the Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times. Ndu Oko, Nigerian by birth, Kenyan by choice, communications expert, Pan-Africanist, a truth seeker and believer in people power.
2 minutes after 9. This is a Situation Room. It's Kenya's biggest conversation. We've been discussing COVID-19, and we're still discussing COVID-19. The issue also that emerges is on the cost. So the government says it's going to come up with a scheme and some package which will include insurance for healthcare workers. The ones that are completely fighting the front line of this COVID-19. There's also the other issue of everybody else who contracts COVID-19 and they go to hospital. Are they coming out of hospital free? Are they paying anything? When you go into quarantine, you're paying.
That's what they say.
When you go to hospital, are you paying?
This is a service that they offered, but do we have any? Why don't we ask Mercy when she comes in to tell us whether people are actually paying?
Yes, we'll do that. In private facilities,
that we know you pay. That we know you pay.
And there was an appeal the other day by the CS for Health saying, look, we are in dire times. People are also not getting medical insurance. The insurance is not covering this. Somebody was saying, this is the lady that we spoke to earlier in the week. Her name was Shiko. Shiko was at Nairobi Hospital. She was there.
She herself is a health worker.
She's a health worker. She was not there because she's positive. She was there because she presented symptoms. So she was in isolation, sort of quarantine, okay, waiting for tests to be conducted and the results to come back. 4 days, walked out a bill of close to 130,000 shillings that you have to pay directly. This is going to be a very expensive affair, especially if insurance companies are saying that this is COVID-19. So if you're there for 4 days, at no point do you test positive for COVID-19. How can it be called a pandemic, that you're there for the pandemic?
Where the problem arises is now we are encountering things we've discussed before in this station regarding healthcare costs and whether they should be actually what they are. And whether our hospitals, apart from just providing care, whether they're just very focused business individuals who want to ensure that they make as much money as possible. I mean, this is a debate we've had. But I want to discuss something a little more positive, because this is a bit gloomy. KPC donated 50 million towards the making of face masks. And they gave this money, or the board decided they were going to give this money to National Youth Service. And I, for one, thought this was a very good thing. Because what it therefore means is that the facility, by the way, National Youth have that facility. They train people in these things. So they already have. Remember the discussion about resources being available?
Yep.
Okay, it's been added. So I don't have the numbers because it doesn't mean what this can do and what it can produce. But clearly, this process of industrialization, this process of awakening the resources that we have is clearly being taken. At the same time, Pwani Oil donated 5.5 kilograms of soap towards COVID.
5 kilograms of soap.
5.5 million kilograms of soap. Kenya Wine Agencies donated 105,000 liters of ethanol to KPC towards, again, COVID. But of even interest in the international scene, the gap that we were talking about that might be created if the U.S. pulls out, it is being reported that Bill and Melinda Gates have said that is all right. We can come in and fill that particular gap.
So what are they going to do? They're going to triple their contribution?
No, just donate a little more. Their contribution as things stand, by the way.
They were the second, right?
Yes, they were second largest contributor.
Yes.
So if they're to continue being the second largest and also meet the gap that's been left by America, that's a huge gap.
No, it's not that huge. Because there's what you call assessed. In essence, that is what people pay. And then there's voluntary, all right? America supposedly volunteered 656 million. Bill and Melinda Gates, 531 million. So that gap isn't as big as you think.
No, it's not. But remember, we are talking about the two. Add them. 656 plus 530.
Yes, and I'm simply trying to say...
Now, unless you're telling me Bill and Melinda Gates are saying that we are going now to contribute 1.1 billion, it's high. The gap of 600 needs to be filled by somebody. It can't be one person.
No, Bill and Melinda Gates are not saying they're going to give $1 billion. They've even stated an exact amount that they're going to give. And I will read it out to you, 150 million to WHO. They've said 150 million. On top of what they're already giving.
On top of that.
My point is...
Theirs will now be 600 and something.
Yes, my point is that vacuum that Trump thinks that he's going to create will not exist. If Bill and Melinda Gates come in, somebody else is going to come in and somebody else is going to come in. These gaps people don't leave open. But what I'm leading to is something a little more interesting. Most people do not know that within the U.S. Army, they have something they call a medical intelligence unit. This unit reports directly to the secretary, they report to the president and the joint chiefs of staff. And late February, when why am I talking about Bill and Melinda Gates? When President Trump was busy telling Americans not to panic, this same unit had already warned the president and said, we are anticipating a pandemic in 30 days' time. They were specific. On the 25th of February, they said so. In 30 days' time. They made this announcement 15 days before the WHO made the announcement. So all this business that we keep hearing of blaming China or blaming WHO, the president had been informed and warned by this unit. Now, why is this unit important? This unit is important because, one, it is nestled in the armed forces, but it also has access to all the 17 U.S. spies agencies. Any information they have on anything, they have access to it. They have access to that information. Meaning, by the time they're telling you this thing, they are not guessing. They're telling you, given all the information we have, this is what we are seeing. And that is partly their job. Their success comes in providing what you call early warnings that provide illnesses and provide conditions like this. The president of the U.S. had been informed.
Okay. Dr. Mercy Korir joins us now. Dr. Mercy, good morning.
Good morning, Eric. Morning, City. Ndo.
Good morning.
Good morning.
I like your conversation this morning on healthcare workers. Yeah, because
what did you like about it specifically, Mercy?
No, the issues you're raising and asking about not just the healthcare workers, your nurses and doctors, but also the other staff. Here, everyone that works in a hospital setting is a frontline worker. So any compensation, any allowances, any insurance should cover everyone who's working in that healthcare facility. So it should not just be limited to your doctors and your nurses because, for example, a a doctor or a nurse is not able to attend to a patient if somebody doesn't will that patient to where they're supposed to be.
Mm-hmm.
This person willing the patient porter, will be as at much risk as the doctor and the nurse.
Mm-hmm.
So everyone working in a healthcare facility is an at-risk staff, is a frontline staff. So everything, whatever package will be worked on, must include all of those stuff.
Mm-hmm.
Yeah. That's one. And then the other one is that healthcare workers, yes, the one that was waking up in December or January going to hospital is still the same one today, but now they face a bigger risk. Every other day they're facing risk. I have colleagues who contracted TB in the wards way before even coronavirus came in.
Yeah.
So just because we have coronavirus doesn't mean the risk has changed. We have always been at risk of contracting anything. Back in at the height of HIV, when you're still learning a few things about it, we had colleagues who contracted from what we call needle stick injuries from pricking themselves. So they're still at risk. So people are still equally at risk, only that now this is just a disease you don't know. So the considerations should now be made because, as you've seen, it's a global pandemic that has affected quite a number. In Africa, we have 311 healthcare workers in total who've been infected. We do not know how many of this we will lose. We hope we don't lose many, but we do not know. So what happens to their families? What happens to, the people who are depending on them? If you look at an African setting, even yourselves, you realize that there are so many people who are looking up to you or whose livelihoods depend on you. Same thing to doctors, nurses, clinical officers. So what happens to their families and their dependents if they lose their lives to this particular infection? So those considerations must be done because these people are more at risk compared to you and I. And I'm happy because even the International Labour Organization gave those guidelines that, COVID is an occupational hazard. It's an occupational disease.
Right.
So,
that's right. From a medical perspective, I mean, we've looked at other diseases in the discussion this morning. We've talked about things like malaria, cholera, etc. Why is this then why is this particular one high risk from a medical perspective? Why is it high risk?
Because of it's highly contagious. Because in any disease, there's those that are highly contagious, and in the lower spectrum of things, there are those that are non-contagious. For example, your non-communicable diseases, diabetes, hypertension. If you are attending to somebody with diabetes, hypertension, you're not going to get it from attending to them. But if you're attending to somebody with Ebola, with Marburg, with coronavirus now, influenza, chances are you can contract it because of the manner of transmission. So it's just that in the whole spectrum of diseases, there are these that are highly contagious and are more risky as opposed to the others. So that's the long and short of why the coronavirus is special. And now with this particular one, is that it is a pandemic. It has affected everyone across the globe, as opposed to something like Ebola, which was in an epidemic in various parts of Africa. Congo is still, DRC is still fighting to get to contain Ebola.
Yeah.
So those ones are still there, but now this one is on a larger scale, a global scale.
Dr. Reed, we were having this discussion with regards to what the president announced yesterday, asking the Ministry of Public Service and the Ministry of Health to come up with a welfare package to cushion medical personnel against the negative consequences of the virus. And this package would include insurance. What would insurance be for in this case?
The insurance he talked about, if I heard him well, was medical insurance. So I'm thinking, because this is government-driven, it should be from NHIF to cover not just the personnel, but also their immediate families who they have put at risk. Yeah, such that if for whatever reason they are falling sick, it is covered. But in retrospect, after he said, I was just thinking, this insurance or this cushion should be for every Kenyan.
Yeah.
And you are talking about cost of care. If you're admitted in Bagathi, for example, you will walk in and walk out. You will not pay a cent.
Mm-hmm.
But if you're in any of the private facilities, you will have a bill.
Okay.
And
So if a doctor in Bagathi contracts COVID-19, we expect that they'd be treated at Bagathi.
Yes.
So they should walk in and walk out without coughing a cent.
Mm-hmm.
They should. So where is the insurance coming in?
Remember, not all your doctors are in Nairobi. You have doctors in various other parts of the country. You have doctors who are not working in Bagathi, but probably they are working in any of the other private facilities. They can contract their illness there. They will need to be admitted in the facility they work in or in any other facility they choose to be admitted in. So there are all of those factors at play where,
Okay,
yes,
but we are talking about doctors working in public facilities across the country. The entire country is preparing to deal with COVID-19.
Mm-hmm.
So if a doctor in any part of the country contracts COVID-19, they will be treated at a local public facility.
That should be the case.
In the county level. And that should also be free, should it not?
That should be the case. But remember, the doctors, just like you, have an option to choose where to be treated.
All right.
To choose where to be treated.
Mm-hmm.
But for me, how I look at it, it should be for all Kenyans, where COVID treatment is covered by the government. I don't want to say free because somebody has to foot that bill.
Yeah.
So I don't want to just look at it as medical personnel only, but also everyone else, because anyone can get the illness. So this medical insurance should be that government foots the bill for anyone in quarantine or isolation for the illness. But we've seen the people in quarantine have had to...
They're paying... Yes, they're footing their own bills.
They are at own cost. The ones in private facilities is at their own cost. So they should not be... These differences should not be there because we are all facing the same thing.
Oh, so your argument is that even those who are in private hospitals should also be paid for by government?
Yes. The government should foot the COVID-related costs.
Across the board, wherever somebody chooses to seek treatment.
Yes. Whether you're a doctor, whether you're a lay person, you should foot the cost across the board. And then the private facilities now should have reasonable costs.
Okay.
Not the astronomical ones that we are used to seeing.
I get your point, because that's the other discussion that emerges. The kind of costs that are coming out of the private hospitals in terms of, because the way you'd bill for every consumable, every item that has basically been used in the process of your treatment. We are seeing people who are getting into hospital for 3-4 days and coming out with over 100,000 shillings in bills. And insurance companies are already calling this a pandemic, so it's not covered.
Yeah. The baseline is healthcare is expensive. For the personal protective gear, for example, a light PPE, I think costs anything between 8,000 to 10,000 shillings now. The light PPE, your bare minimum. And in private facilities where they are following everything to the letter, you'd find that everyone coming in, if you have 2 nurses and 2 doctors, those are 4 people. After they have seen you, they have to discard that. They bill you for it. So we have to find a way, if we as the taxpayers are to put that bill of the private facilities meeting the taxpayer halfway, so that it's a win-win for everyone. Because this is not the time to be making astronomical profits. Everyone is, struggling across board, whether individually or even corporate, even the insurance companies themselves who are supposed to foot that bill are struggling, or if at all they are going to foot that bill because they said it's a pandemic.
That's the other discussion we'll have another day. 20 minutes after 9, Dr. Let's take a look at weather and then we continue the conversation. And we start taking the questions from our audience. Anybody who's got a question or a concern regarding COVID-19. 0719-012-600. Ask Dr. Marcy. Good morning.
All right, let's see what it looks like now in Nairobi at 21 degrees. It's slightly warm this morning. We'll see highs of 25 and lows of 16, definite showers in the afternoon. In Nyeri at 20 degrees, it's partly cloudy. Showers expected with highs of 24 and lows of 16. Nakuru is mostly cloudy at 19 degrees. Thunderstorms expected in the afternoon with highs of 24 and lows of 19. It's 19 degrees in Eldoret this morning. Expecting rain later in the day with highs of 22 and lows of 14. It's mostly cloudy in Kisumu at 24 degrees. Showers are going to start quite early then with highs of 27. Cloudy conditions all through Malindi at 28 degrees. Showers are going to follow quite shortly. Highs of 31 and lows of 26. Mombasa at 28 degrees is mostly cloudy. Thunderstorms expected later with highs of 29 and lows of 25. Dar es Salaam this morning is mostly cloudy at 26 degrees, highs of 29 with thunderstorms expected in the afternoon. It's mostly cloudy in Kampala at 22 degrees, thunderstorms expected there too later with highs of 22. In Johannesburg at 13 degrees, it's mostly sunny this morning. Clear skies in the afternoon with highs of 22 and lows of 11. Finally, in Lagos, looking at the weather for the weekend, 28 degrees and partly cloudy. This morning, though, thunderstorms forecasted for most of the coming days. Highs of 33 and lows of 27.
Classic soul, R&B, smooth jazz, neo soul, and nostalgic ballads.
Make some noise. Yeah.
You're listening to Spice FM.
This is a
mature, intelligent talk every morning. Spice up yourself.
Any questions you'd like to ask her, Dr. Marcy
Mornings done right. 94
on Facebook and on Instagram. You can post your questions there. Some questions coming in.
All right, well, let's start with one of the ones of this whole quarantine issue, whereby we saw the extended quarantine to 28 days, Daktari, and then now we see an additional 14 days, and then if the same conditions which Dr. Amoth had talked about then yesterday pursue, you're looking at people staying in quarantine for another 42 days, and having been told that they're negative, it looks like an endless cycle is going to start here, and is this going to be the case?
Actually, we were discussing with one of my colleagues at Docs, and we are now thinking it's starting to sound like detention.
Right.
It is.
Yeah, because I mean, it is not a crime to have been exposed or to be at risk of contracting the coronavirus. I think if there was a risk that these people still expose themselves to the virus or somebody turned positive, then the government, the Ministry of Health, should look at ways and explore these ways. And I'd even asked them of having home-based quarantine, home-based isolation for these particular people. And you realize that the people who are in quarantine actually are in a position to have a room for themselves where they can stay in. The Ministry of Health has access to thousands of community health workers that they can contract. If they want, they can even add the NYS. I don't want to say the police because they are engaged in other things, but they can add the NYS to be doing daily checks on these particular people, even if it's twice a day, just to make sure that they're still in their households, because we are not talking about people who would be in informal settlements, and therefore even tracking where they live might be a challenge. These are people who are fairly well off, and you are able to track and see. So I think our approach to how we are handling suspected people who've been suspected to have contracted the coronavirus or who have been confirmed will cause more people to shy away from coming out when they have symptoms, which will be a bigger problem. We are making it like it's beginning to be like a crime. Yeah, and so with this detention, yes, people are bound to be frustrated. We've seen Dr. Macharia just in isolation alone, and he is struggling psychologically with the situation. So what about people who have been given extended stays in quarantine? It's going to be difficult, and we are probably breeding something that we may not be able to handle later on. So I think it's unfair.
So let me take this one caller. This is Eric calling in from Nanyuki. He has a question for you. Eric, good morning.
Okay, Mr. I want to greet Duoko, Siti Muga, and Eric Ratish. Okay, I have one simple question.
Yes.
I was really concerned about the extended quarantine period, and I was truly and humbly asking the president to consider the people who are the innocent wananchi who have been quarantined in private institutions and who are having to put the bills on their own cost. I was really asking the president, instead of giving the 200 million shillings to the musicians, he would step up to those isolation centers and the quarantine centers and start supporting those individuals, like paying their bills, so that no one would have to foot the bills from their own pockets.
That's a good suggestion. It's a good one, Dr. Isn't it?
It is. But luckily, I don't know if it's luckily, but the extended quarantine is in 5 facilities and they're all government. So, yeah. So there are 5, they're all government. So my assumption is that everyone who has been in the private facilities has been discharged to go home. But then again, there was the issue of the extended 14-day quarantine. Who foots that bill?
Yeah.
And in my opinion, I think, I don't want to say government, but the taxpayer should, so that at least we meet people halfway. They've already foot the bill for 14 days. Extending it to 1 month is punitive, and because we are facing difficult times across board. So probably the taxpayer, through the government, should foot that particular bill for those people.
You've also raised the issue.
Our approach generally to quarantine and isolation is not people-centered. We are, in my opinion, treating the disease and not the person.
You raised the issue of your conversation with Dr. Danson Macharia, who is now in isolation, undergoing treatment for COVID-19. And he talked about, the kind of mental strain that he is undergoing. The people in quarantine facilities, even from your conversation with others, are they getting any sort of psychological support?
No, none that I know of. I think the closest to psychological support that I've seen is Red Cross saying we have this our toll-free number. If you need help, call us. But I've not seen or heard anyone going to quarantine facilities and saying now we are counselors or we are here to offer psychological help because we are part of the Ministry of Health team that needs to come and talk to or find out how people are faring on. That's what I'm saying. We are managing the disease. We are seeing the virus. We are not seeing the person. Because if we are seeing the person, then this should have been some of the considerations that should have been there from the outset when people are going into mandatory quarantine. Then send in counselors together with the medical officers who are going to talk to people about the coronavirus. Part of it should have been a team to go and just talk to people about the situation, the circumstances, and how to cope. Because now we're seeing people have had to find their own ways of coping. People have taken to social media. Those that can access a counselor have done that. So it's been very individual based as opposed to an exercise driven by the officials who are handling the whole coronavirus situation in the country.
Okay, Dr. To go back to an issue on quarantine, a question in here is that even if I do have symptoms, what I'm seeing is happening in some of these quarantine centers, I really don't want to go there. Because if you're tested negative, which we've seen in this case by a number of people, according to the reports that we've heard, and then being tested a second time, and you're still not allowed to go home, and then being shown negative, you're still not allowed to go home. What guarantee then do you have of other people who may then be quarantined in the future going home, even after having tested negative?
I think, there are two issues here. With there's the quarantine and there's isolation. So with the quarantine, this was for people who've been suspected to have been exposed, and the people in mandatory quarantine are people who are coming in from other countries. So the whole point of putting them in mandatory quarantine was so that they can test and see who has been exposed, who has not been exposed, with an aim of discharging people to go home. But then when they were to be discharged, the government came and said people did not observe measures of physical distancing and hygiene and whatnot in the quarantine facilities. So we extend by another 14 days because there are some people who tested positive in some of those institutions, and therefore we do not know who they met or who they didn't meet. So that was the basis. Ideally, if the quarantine rules had been followed to the letter, then you would have been able to know. Like for example, Dr. Mashara, who tested positive, it should have been easy to know who did he meet in the Pride in Lantana where he was. Who did they interact with? So from his story, for example, he says being a medical doctor and working in an institution that had already even initiated some of these measures early, he was in his room the entire time. So he hardly came in contact with anyone. And he was the only person in his facility who tested positive. But then the extension was done for everyone else. So there are some gaps that should be for people in quarantine facilities. Now, I think that is now a thing of the past. Now, what we are looking at, because now we are in community transmission, is that even if I have been exposed, or I know I've been exposed to somebody who is COVID positive, chances are I will not say, because of how I'm seeing the government
is going to treat me.
Exactly. How it's handling. People are being wrapped up by police, being picked up in the middle of the night to go to isolation. Isolation itself is not conducive. So what we are risking is that people will not own up and come out and say, I think I have been exposed. I should stay in isolation, which for me is a much, much bigger problem.
Dr. Ari, let's take a short break, take a look at traffic, and then we come back. We have callers on the line waiting to ask you a couple of questions. 26 minutes to 10 o'clock. Good morning.
Right. Not much on the streets in terms of traffic right now. It looks pretty good getting into the weekend, guys. Nothing out of the ordinary. If it does happen, be sure to let us know. You know how you can reach us on SpiceFMKE on Twitter. Let us know what you see. We can spread that information and at least keep people safe. But for now, it all looks good. Remember, going into public, you need to make sure that you have your mask on. You're protecting yourself and others.
Spice up your life.
So questions for Dr.
Mature, intelligent talk every morning. Spice up yourself.
012-600. So Terry, there's some who's in Kisumu.
Yes.
Mornings done right.
Hello.
Just go ahead.
Hello.
I can hear you. Just continue.
Okay. My question is,
yes.
I've heard a lot about preparedness, and I really love the way Dr. Mercy Korir has been on air and explaining what's going on. But if you take the case of what happened in Siaya, to me it appeared like a system panic. Like, really even medics and other systems are not prepared to deal with this pandemic. I'm talking about the burial that happened at night in Siaya.
Yeah.
If you follow the sequence of what happened, to me, I describe it as a system panic, and that really sends fear in us, and has a consequence of, of stopping people from appearing for tests and even visiting hospitals. Because if you saw what happened, it was really strange. It will scare many people from going to be tested and, appearing in health facilities. So my concern here is there system panic? Are we really prepared, from what Mercy can describe about this? And number two, the question of allowance. And Mercy is a very eloquent person, very knowledgeable person. But when you asked her that question just a short while ago, I saw she really struggled to qualify this pandemic as a unique one that deserves a special allowance. For me, she was really looking for awards in spite of her eloquence. Now, world over, are there ways of dealing with this pandemic in terms of allowances? Are there standard ways of classifying so that we say, okay, this one now when it happens, this kind of pandemic, it qualifies medics for special allowance. And I saw what happened to the Prime Minister of UK when she mentioned people. She went on there and mentioned distinguished nurses who supported her. Don't we have another way, non-financial way of compensating people other than just money? Because I have a problem with
what
every
would
time.
you suggest as an alternative?
No, what Boris Johnson did, Muga, is she just mentioned people. I've been in organizations where your CEO writes for you a letter, recognizing your capacity, recognizing your uniqueness in terms of support that you've given, and non-monetary. So my concern here is, why does it become a monetary compensation all the time? And let me give you a simple example. These days in Kenya, if you stop in a place, if you are driving and you ask somebody to show you a place, they will show you, okay, that's where you wanted to go. Then after that, they will ask you for some money because you've gone into money compensation. So somebody shows you a direction and asks you for money.
Yeah.
Now professionals now have gone into it,
and asking for money.
They are also saying, give us money.
Thank you, Sam. Let's now pick Eric in Nanyuki, also who has a question. Eric, good morning.
Okay, I was talking about the president supporting the on-inches on quarantine.
Mm-hmm.
Okay, but when it comes to insectives, I think the president should recognize those nurses who are volunteering to fight this pandemic that is unknown. So, I think just as the Prime Minister of UK did, also President Uhuru Kenyatta should step up and recognize this good work, because volunteering to fight a pandemic that does not have a cure is not a simple thing. So I think even instead of the incentives, the president can just recognize them in another way that does not even involve money.
Like national awards.
Yeah, like national awards, yes.
Thank you. Zachary in Nakuru, good morning.
Good morning.
Good morning.
Good morning.
Yeah, very good morning, everyone.
Yes.
Yeah, this is Zachary. And hi, Daktari.
Yeah, Zachary, good morning to you.
Morning, Daktari. Now,
yes, Zachary.
There is this issue of these people complaining about you being quarantined, yeah?
Mm-hmm.
This is our pandemic, Mr. Ratif.
Mm-hmm.
And everybody who cares about his life and others' life should actually awake to the reality. First of all, I would want to tell those people who are in quarantine that we are also in quarantine and we are not having parties here. And it is the government's mandate to secure and to safeguard everyone's life. So even if they come out of the so-called quarantine, they are also entering into a larger, in fact, more dangerous and more punitive quarantine. That is outside here, okay?
Mm-hmm.
So once they are there, they are better off than us, in fact. In fact, I'm looking also to go there and they say, oh, I also to be put here, okay?
And stay a month.
And probably stay a month, because once I say that we are not getting enough food, somebody probably will hear and chip in, yeah? But now we are outside, yeah?
Mm. So
like now
for you, you're saying that those in quarantine should not complain.
They shouldn't. Actually, they shouldn't. And
thank you, Zachary. Let's hear the Daktari now respond to these questions and concerns that have been raised.
Okay. I think the issue with quarantine, let me start with that one, is not. It is just. I think we've talked to the people who've been there. It's like being in a detention facility, which psychologically is not a very good place to be. I don't think it's about the where, but about the circumstances around where they are in, and the psychological toll, the mental toll it has on people. I think as a country, and maybe even in the African continent, we're not used to talking about mental health as a big priority. So for me, how I see quarantine and the mandatory quarantine is that you are confined in a place, you are limited in what you can do, you are limited in who you can see, and really you are limited a lot. So that weighs a lot psychologically on very many people, as opposed to if you're in quarantine in your own house, even if you're staying in your room the whole day and not even getting anywhere, there's some comfort and there's some peace of mind in being in a familiar environment. So for me, the quarantine issue is more from a psychological point of view, from a mental health point of view, than anything else. Then some was talking about, is there system panic, medics not prepared? Specifically for the CIR case, I know everything had been going right from what I was able to pick from the medics who attended to Oyugi. Everything had been going right up to the point of the burial, because they did everything as per protocol, where you decontaminate the area, you put the body in a body bag very well. Everything had been going right up to the point where they are going to bury Oyugi, where now it was rushed. So in terms, I don't know what the hurry was, because people have 24 hours to bury a body. I really don't understand what the hurry was. So for me, what I picked is that many healthcare workers, even in the counties, know what to do, and when they are well equipped, they will do the right thing. So that lapse was, I hope, just that once, and it will not happen again, because it was the first time that we saw such a thing happening. So in terms of preparedness, a month ago when we were talking about this thing about now we have our first case and whatnot, I could say we were hardly prepared. But now I think I can say a good number of healthcare workers know what to do and are well prepped. So we are definitely in a better place as compared to where we started all this. The allowances for the frontline healthcare workers and why COVID, because it's a pandemic, means it needs special consideration, unlike the other diseases which we know of. So the people in the front lines, be it healthcare workers or other hospital staffers, need special consideration, because here we have a disease that we don't know. For example, we do not know if people who have COVID pneumonia, if their lungs would be able to go back to normal. We don't know. We can only know after some time. So we are dealing with something we do not fully understand. So let's say, for example, a healthcare worker and nurse suffers COVID pneumonia and their lungs are damaged and they need to be on oxygen thereafter. They are unable to work. How do you compensate such kind of persons? So that's why the whole conversation about compensating these people, and it has to be monetary, because if you're incapacitated from working and making a living because of a hospital-acquired infection, then there has to be compensation for you to continue living the way you are living. And this is standard across, as in the guidelines are standard across board. Now, what differs is what each government does for its healthcare workers.
Okay.
Public recognition is good, like the way Boris Johnson did for some of the two nurses, and he said there was a long list. So public recognition, yes, is good, but at the end of the day, if you have suffered an infection or if you die, what happens to the people who are depending on you? So monetary compensation has to be on the table. It has to be.
Like some more questions on social media.
Okay, the next one, Dr. Harry, is about mass testing. Quite a number of. So if mass testing is going to roll out next week, how is this going to work? And people are asking then, what do we need to do?
The minister hasn't been very clear about mass testing. And in my opinion, I think by using the word mass testing, they are sending the wrong message. They should be very clear, because what I have seen them doing and what has started is testing of healthcare workers who are in the front lines, and they're testing all healthcare workers. They haven't even reached all of the healthcare workers across the country or in the counties that have been high risk. So this mass testing really is starting from the people at most risk, which is our healthcare workers, our frontline service providers. And I saw yesterday online on Twitter, somebody was asking if the touts on the matatu stages were going to also be part of the mass testing. And for me, anyone who really meets many people at a go, like those touts, the public service vehicle drivers and touts, the long distance drivers should be part of the group that starts this public testing. Now, what happens to the rest of the public? Knowing what I know about our capacity, our lab capacity in terms of diagnostic kits and reagents, as at now, is not very clear, because we'll not be able to do millions and millions of tests unless we change our approach of testing.
Dr. Mercy, I need to ask this question. Once somebody gets infected, does it then mean that you develop immunity?
So I've been looking at literature around that, and one of the ones, I think it was from China, was that somebody develops immunity for a year or two. They are not quite certain of how long. So that's why you see some countries are beginning to slowly lift restrictions, because if there is proof through antibody testing, that's checking if you developed any immunity through the rapid test kits, like the ones that Cambridge wants to develop, then you have an idea who in your community or society has gotten infected and therefore developed immunity and would not be able to contract the virus back. But now you see, I think it was in Singapore, where some people have been either tested positive or infected. They are not quite sure. So they want to check, is it that the virus is still manifesting? Because the maximum they saw the virus being in the body was 39 days. So they want to check, is it that the virus was still present, or is this a new infection? What is happening? So as you said, we are learning along the way. But from some literature, they're saying that, a section of the community would develop some immunity. So that's why the testing, and which is the point I was going to get to, the testing that is done should be two-phase. One, where you check for active infection, particularly from your high-risk groups, that is the healthcare workers, the police, the supermarket people, public service vehicle people. You check active disease. But in the rest of the population, check for antibodies. So you're checking if anyone had been infected before, and if they've developed any immunity to it, so that now you're able to make decisions on restrictions and lifting some of the curfews, like in Kenya, or the ban. So it has to be two-pronged. So what we are not sure is what this government, what we are not certain of, is what plan the Ministry of Health is exploring in being able to get that information that would inform some of the decisions that they're supposed to make.
But whenever the medical world talks about a second wave, if we assume that upon infection you do develop immunity, it arises from the point that there will be a large portion of the population who are not infected. And so if the disease now gets them, you then have a second wave.
Yes. That's why I'm saying when you're testing for active infection, you concurrently test for immunity, so that you're able to know the proportion of the population that hasn't been infected or that hasn't developed any immunity, so that either you quarantine them or isolate them, and you let only those people who've developed immunity to be actively productive and participating in other activities, so that you prevent these other ones who haven't developed any immunity from contracting the disease and causing you that second wave that you're talking about. So it has to be concurrently checked.
Okay. Just going back to this mass testing question, obviously, the more cases in Kenya that are received is as a result of the testing that is taking place. So if there's mass testing, the likelihood of more cases then being resulting is high. Looking at how things have progressed over the last couple of months, is our capacity now stronger to handle more cases that might then need to go into isolation and for treatment?
So when cases are identified, we should rank from people who are asymptomatic, who have no symptoms at all, people with mild symptoms, moderate symptoms, and those that are severely ill. The people without any symptoms up to those with moderate symptoms can isolate at home. They can manage that at home. The issue is people who are severely ill and critically ill, because now those ones need hospital-based care, and some will need critical care. So in terms of our capacity to handle that, nothing has changed over the last 1 month. The same 400, 500 ICU beds are still the same. The same deficit in ventilators is still there. Nothing has changed. So in terms of handling severely ill patients, we are still at status quo, though I've seen some people, saying, oh, now we've opened ICU capacity and whatnot. But then when you ask them about staff that will run that ICU, they do not have them. So for me, having a bed and a monitor is not going to help me unless you have people who will manage that.
Yeah.
So that's why I'm saying we are still at status quo, because if you haven't manned those particular facilities, then you've really not done anything apart from just painting a room, putting a bed and putting a monitor, which anyone can do.
Right.
So managing severely ill patients, we are still at status quo. Managing people without any symptoms or mild symptoms, that can be done at home. That doesn't need to be hospital-based. And that is probably what we should be looking at, because if numbers increase, then you do not want to have people who are otherwise, quote-unquote, healthy, occupying bed space. They can stay at home and leave the bed space for people who will actually need it.
Who need it. Okay. On the issue of wearing masks, another question from Paul is, how long then should I have the mask before I need to dispose of it or wash it?
Okay. This issue of masks, okay, let me put here my personal opinion. Yeah, this is from my experience having been in the hospital using masks and my experience out here with masks. So this is my very personal opinion. There may not be much science around it, but just from my experience, is that for the public, everyone going about their duties out here, use a fabric mask. Because with a fabric mask, you can wear it the whole day. At the end of the day, you wash it with the Ministry of Health says soap and warm hot water and soap. But you can wash it. You can even wash it with Jik to disinfect it, air dry it outside, and you can use it. It becomes cheaper. Two, and which is what is most important for me, is I find fabric masks, they're easier to breathe inside the fabric masks as opposed to the other masks.
But now, Daktari, on those other ones, we see folks walking around with them. They started out blue, and then after day 3, they are brown. So are you saying essentially that there's nothing that is being protected?
Yeah, don't use those ones because they're supposed to be single use, and that's what I'm saying. Because they are difficult to breathe inside, you find that you have to keep on adjusting it. So what happens is that's why it turns from blue to brown, because you keep adjusting it. People putting it on their chest, on their forehead. Some are removing it and placing it on tables and still wearing it back. So at the end of the day, you have just contaminated yourself over and over. It's supposed to be single use. That means, let's say if you're doing a surgery, for example, you wear a mask, and by the end of your 4-6 hours, for example, you dispose it and you get another one for another patient. But now here we see people wearing the whole day. They are contaminating themselves with it and whatnot. So I would advocate for the fabric mask because you can breathe easy in it. So you don't need to keep adjusting.
Right.
And at the end of the day, you can actually disinfect. So it will have less chance of causing any contamination. These other ones, now the N95, you're supposed to have a sanitizer spray so that you are able to use it, let's say, for a week. Because now every time you remove it, you spray both inside and outside to sanitize it and put it back. But now that becomes the cost issues around that may not be really practical for everyone. So a fabric mask for me is practical.
Is the way to go. Dr. Thank you very much for joining us today.
Thank you very much.
We'll speak with you again on Monday and the whole of next week, God willing.
Inshallah.
Asante sana.
Now, today's proverb, Daktari, is one you'll find interesting.
One who causes others misfortune also teaches them wisdom.
Is that in reference to the coronavirus?
Yes,
to life.
To life. Take your pick.
Thank you very much, Doc. Have a
Thank
great
you.
weekend. Thank you very much, folks, for
You
tuning
too,
in
guys. Have a
to
good
us
one.
this week. 0719-012-600 is the number to call. However, join us again from Monday next week, 6 a.m. to 10 a.m. This is a Situation Room, Kenya's biggest conversation. Goodbye from us, CT Muga, Nduoko, and Eric Latif. Have a great weekend. Now until 2 p.m., uninterrupted music, sugar and spice, and everything nice. And then Monique joins you from 2 to 6 p.m. on Spice Drive. And thereafter, the adults in the room will be here. And this week is Kisiangani, Emmanuel Kisiangani, and Barbara Mbaka, the Duchess of Ikolomani. Good morning. It's 10 o'clock. Goodbye.